start, sir?
I'm ready.
Okay. A very good evening to one and all present here. It is really a privilege, and on behalf of I'm very happy to conduct this marathon CME. TNFOG, our newly formed federation for the past 1 year, is conducting its academic activities regularly. And this is one more activity which we are doing. We are very happy, and I wish all the doctors here a very belated Doctors' Day once again. And on behalf of the doctors, every time we keep talking about various aspects of obstetrics and gynecology, diseases, its management. So for a change, we thought, why not talk about our own well-being? So here we have a CME on your well-being, where we have focused on talks for the health of doctors, both physical and mental health, where we really lack. We care for others, but it is high time we take care of ourselves always. So a talk on that, which is going to be delivered by eminent speakers, a gynecologist and a psychiatrist. They're doing the talk. And then we have two speakers, one who's going to address us on all the financial issues. We really, that is one area which we really lack in. Not many people are very confident about handling our finances. And we have an expert with us, a financial consultant, who's going to address us on that. And of course, our dear own Dr. Patel, sir, who is going to speak to us about the various laws and its practical aspects in our management of the same. And then we have with us our Dr. Nancy, who is going to speak to us on the post-retirement life, which is absolutely essential for a very peaceful life later. So how we are going to plan our future ahead. It's really a very interesting CME program. I hope all the speakers will definitely do justice to the topic, and I hope it will really be engaging the audience. And I request our President, Madam, Dr. Anjalakshi Chandrasekhar, to kindly welcome the gathering. Can I have Madam's CV, please? Anjalakshi Madam doesn't need any specific introduction to this August gathering. Can we have her CV, ma, please?
Can we have the Tamil Thai Valthu, ma? Tamil Thai Valthu?
Yes. So we'll finish that and then, yes, Madam. We'll have the Tamil Thai Valthu. Chitrakala, can you kindly play it, please?
We'll have the lighting of Kuthuvilakku now.
Yeah. Let's play.
Yes, Vijay.
Thank you very much for the this thing. Thanks to all the dignitaries, our chief guest, Dr. Kurian sir and Anjalakshi Madam, for digitally lighting the Kuthuvilakku and inaugurating the CMA program. Can I have Madam's slide, please? Yeah. Anjalakshi Meenakshi Madam definitely doesn't need introduction to this August gathering. Madam being the founder president of this Tamil Nadu Federation of Obstetrics and Gynecology. She has been the past president of OGSI and she has had government service, so many years of service to her credit. Madam, I request you kindly to formally welcome the gathering.
Okay, thank you, Dr. Vijayalakshmi. It's good evening, everyone. First of all, let me wish the happy Doctor's Day. And my dear and respected chief guest, Dr. Kurian Joseph, chairpersons, Dr. Vasanta Mani, Dr. Malati Prasad, Dr. Preeti, Dr. Mary Annie, and speakers, MC Patel, Dr. Nancy, and Dr. Radha Madhavi, Dr. Selva Kumar, and Mr. Rajaguru. It is my proud privilege and to give the welcome address for today's program. TNFOG is conducting many CMEs on different subjects for consultant and junior colleagues and Bodhana program for the postgraduates and a public awareness program on women's health, cancer, and GDM, and also field work. TNFOG is interested in the welfare of our own professional comrades also. I congratulate Dr. Vijayalakshmi, the treasurer of TNFOG, for choosing this topic. We are always talk about our patients. For a change, this month being Doctor's Day month, we thought we will have a CME on the well-being of ourselves. Nowadays, the idiot syndrome, that is the internet-derived information, which is obstructing the treatment, has become a big challenge to the medical profession, and doctors are falling sick because of stress and sometimes to the extent of even committing suicide. We need to take care of our health as well as the wealth. In today's world, there is an added pressure to acquire the communication skill rather than the just technical and professional skills. And today's topic being your well-being is very apt. And there are talks on the how to take care of your health, manage your wealth, and know your loss of the land and plan your future ahead. I welcome wholeheartedly our beloved friend, Dr. Kurian Joseph, to be the chief guest. We are happy and thankful, Dr. Kurian, for you accepting this invitation among his busy schedule. Many of us have been trained in the art of laparoscopy, that is a minimally invasive surgery by Dr. Kurian. I welcome Dr. Kurian once again. I welcome Dr. MC Patel, who has readily agreed to talk on the laws we should know. He is the authority in that and apt person for the talk. I welcome you, sir. I welcome the chairpersons and the speakers, and my warm welcome to all delegates. The CME is for your wellness, and so kindly feel free to clarify all your doubts. And I welcome Dr. Kurian once again to be the chief guest and other faculties. And I request Kurian to bless the CME with his words of wisdom and also release the newsletter after his speech. I welcome everyone for the CME and make it a success. Thank you, Jai Hind. To introduce Dr. Kurian Joseph, he is the director of Joseph Hospitals, a 60-bedded obstetrics and gynec hospital. He is a pioneer in gynec endoscopy surgery in India, started training endoscopists from 1995, have trained many doctors from India and abroad. He is a chairman of the endoscopy committee, president Asia Oceania Federation of Obstetrics and Gynecology, TNFOG, between 2013 to 2015. He is the International Society Gynec Endoscopy board member till 2011 and re-elected in 2016 up to 2020. He is Federation of Obstetrics and Gynec Society of India, FOGSI Vice President in 2008. And he was organizing chairman for AICOG 2015 at Chennai. So everybody will remember about that AICOG. And Obstetric Gynec Society of Southern India, OGSI, is a past president and chairman Tamil Nadu chapters of Indian Association of Gynec Endoscopy. He has got many laurels to his credit. I invite Dr. Kurian and deliver his speech. Thank you.
Good evening, madam. Am I heard? You can hear me?
Yes, sir. Yes, sir.
Good evening to everybody, and thank you for your kind invitation. Good evening to all the delegates and all the senior faces I'm seeing from all over Tamil Nadu. I think a real word of congratulations to the Tamil Nadu Federation for organizing such an sort of interesting program with so much of action for the doctors themselves. I think full credit to Dr. Anjalakshi and Dr. Vijay Lakshmi, who has been the brain behind organizing this. I just want to tell you a small story. A senior professor called many of his alumni to his house, and they all sat around the table and they were discussing and saying there's so many problems and difficulties all over the world. So the professor had made a big pot of coffee, and he had kept many cups on the table. The cups were of different varieties. Some were very pretty, fancy cups. Then there were the more ordinary cups. And then there were the plain glass cups. So he told all the students, pick up a cup and let's have some coffee. So they all took some coffee in a cup. And then he saw all the expensive, pretty, fancy cups were all taken. The ordinary cups were all still left there. So he said, what are we aiming at? We are aiming at trying to drink some coffee. Does the coffee change based on the cup?
No.
So this is like the story of our life. Very often, we try to go for the cup rather than the coffee. The coffee is our life, and that's what we should all concentrate on. And to do that, today we've got wonderful stories. We've got stories of health. You hear of so many stories of doctors, you know, the classic proverb, operation successful, but doctor died because the doctor hasn't taken care of his health at all. We've got speakers telling us stories of that. Wealth is becoming a big problem. Traditionally, we all had methods of earning wealth from support from the pharma companies, support from bank deposits, support from properties. But today, all these things have got closed in different ways. And I'm sure the speaker on that will highlight all these factors. The laws of the land have become more strict. The government has started implementing it more often. And this is where I think the organization also will have to play a big role. I can tell you a simple example. For the past 2.5 months, I've been trying to get a narcotic license for our hospital. All the records are intact, but the clerk, the narcotic agency, the collector, the tahsildar, we have to go through all these people. Can't we have a simple system where online we just file the papers, get the license? I mean, this is where the association has to play a role. And finally, the future. I think if we don't think of the future is not going to take care of us. It's not automatic. So we need to do all. So I think we must all listen to these speakers and try and adapt maybe 1 or 2 points which will help us. I just like to leave with a word that the richest person is not the one who has the most, but rather is the one who needs the least.
Yes.
Don't be a parasite on the society. So thank you very much for inviting me, and I wish the program all success. Thank you very much.
Thank you, Dr. Kurian. You can release the newsletter.
Yep, I'd like to release the newsletter, and I hope it makes good reading to all of you.
Yes.
I'm sure Dr. Anjalakshi and Vijay would have done a wonderful job in producing a good, interesting newsletter. Thank you very much.
Thank you. Thank you. Vijay?
Thank you very much, Kurian sir. Thank you very much, Anjalakshi madam.
Yes.
It was truly nice having you, sir. Thank you very much, madam. I mean, she's the newsletters are being okay. Okay, Chitrakala. I think people people can see it on. I mean, it will be uploaded on the website within a week's time, and all of us can read through the contents of the newsletter. The newsletter carries information on all the talks that are given today And also the previous month, we had just 2 topics, so that those topics are also covered in this present newsletter. Thank you, Chitrakala. Thank you, Kurian sir, and thank you, Anjalakshi madam. And now we shall move on to the scientific session. Can I have the slide of Meena, please? We have with us today evening a very enthusiastic obstetrician and executive member of OGSI, Dr. Meena Mahalingam. Meena is somebody who says no to nothing. Whenever we request her, whatever kind of help, she is truly ready to do it for us. And congratulations, Meena, on acquiring your present degree, MRCOG. She is the Senior Assistant Professor, Department of Obs and Gynae at the Institute of Kasturba Gandhi Hospital for Women and Children, Triplicane. And she is trained in everything. And she's a wonderful person. Meena, over to you to take care of the entire scientific session. Thank you very much for the coordination.
Hello. Hello.
Yeah, Meena, we can hear. We can hear you.
Can I have the chairperson CV, ma'am?
Yeah, it will come.
Hello, it's my, it takes proud privilege for me to introduce Vasundamani ma'am, who was my professor. And now she's a consultant in Parvati Ammal Hospital. She has received a lot of awards, Best Performance Award from Department of Health and Family Welfare, award from Biomaterial Center for year 2018. And she was the dean at Government Viluppuram and Kilpauk Medical College, and she has got more publications to her credit. And I would like to introduce the next chairperson, Dr. Malti Prasad ma'am. Can I have the next chairperson's CV? So Malti Prasad ma'am, she is the director, Trichy Fetal Medicine and Fertility Center. She has won the first prize for paper on fetoscopic skin biopsy in epidermolysis bullosa in National Conference Dakshin 2011 and best prize paper at TNFOG and more publications to her credit. As she has got some
I have joined.
Yes, as she has requested, I would like to request Vasundamani ma'am. She wants to introduce the first speaker, Radha Madhavi ma'am. Over to you, Malti ma'am.
Yeah. Good afternoon, everyone. It's a pleasure to be a part of TNFOG. And today we have very interesting topics pertaining to doctors. For example, taking care of your health. We have interesting speakers, Dr. Radha Madhavi and Dr. M. Selvakumar will be talking on that. Dr. Radha Madhavi is the founder president of Tiruvannamalai OG Society, and she's the director of Raja Multi-Specialty Hospital. Mr. M. Selvakumar is a consultant psychiatrist at District Mental Health Review. So with a short introduction, I request the speakers to take on to the dais. Thank you. Over to Dr. Radha Madhavi, please.
Good evening, everybody. Good evening. At the outset, I would like to thank TNFOG and its office bearers for this opportunity. I convey my regards to Chief Guest Dr. Kurian Joseph, Chairpersons Dr. Vasanta Kumari, Dr. Malati, Dr. Preeti, Dr. Mary Ann, Dr. MC Patel and Dr. Nancy, and the MOC Dr. Meena. To begin with, take care of your health. Can I have my slides, please? Next slide, please. I am coming from this wonderful town called Tiruvannamalai. Now it is a district headquarters. When I came here 35 years back, it was a small village. Next slide, please. My topic for today is take care of your health. Actually, it's an irony to talk about your health to the very people who take care of others' health. It's actually a tragic comedy, but it is the need of the hour. It is so much the need of the hour because statistics have shown us what we are going through. Next slide, please. Physicians heal thyself. Health is not merely absence of disease. Indians and Greeks knew it from the ancient times. Health and harmony go hand in hand. My topic, along with my good friend Dr. Selvakumar, will be health. I will be are concentrating on Soma, and Dr. Selva Kumar will talk on the psych. Both are actually intertwined for a healthy life. As we know, modern medicine has changed so much. Now we are so much preoccupied with disease, we are losing the art of healing others and healing ourselves too. We have literally been commodified. We as doctors lose our lives literally to improve the lives of others. Our health is a neglected entity right from our student days. Right from the time we are all in the rat race to get a seat into the medical colleges and going through one of the toughest courses. And I don't have to explain to this august audience what we have all gone through just to get our degrees. And then we go into the another rat race of being a doctor in this wide world. And basically, we all don't follow what we all preach to others. Next slide. These are 4 aspects we neglect maximum: eat, exercise, sleep, and relaxation. Coming to what we eat. What we eat is what we are. Previous slide, please. What we eat is what we are. We just don't have time to chew our food. We just gobble the food, whatever is available. And before we are satisfied, we eat so many empty calories without our knowledge. We don't relish our food. We just gobble all the food and eat all the empty calories and spoil our health. Now, next is the exercise. I don't even know whether we all know the spelling of this through our lives. Only when we realize we have lost so much to it. Sleep, the less we set, the better. Because there is in modern day, we have been hijacked by our patients and society at large. We don't get to sleep properly. We are disturbed all the time. And even in our sleep, we think only of our patients, I think. And relaxation is unknown to us. We compromise on all these aspects in our life, right from our student days, from the time we start our practice, in our middle age, as the next speakers and all will explain to us what we are losing in this life. Next slide, please. The statistics in the present day, especially after the pandemic, is really scary. We have died in large numbers, and our lifespan is almost a decade less than the common man. For what? For saving them all our lives. Our lifespan is 1 decade to 15 years less than them. It's not worth all the trouble we are going through. Just to go through the number of deaths. I think all the people in our community in Tamil Nadu, we have been exposed to so many people who have passed away in the past 4 or 5 years. And to give some examples, maximum deaths have happened with anesthetists also. I know of 4 to 5 anesthetists who have committed suicide. The reasons are umpteen. Gynecologists, anesthetists, recently we went through such trauma when our colleague had committed suicide. There is so much doctor passing happening in this community. Who is to blame for this? I really cannot understand. We doctors have died due to various causes: occupational, infectious, psychosomatic. Next slide, please. We are exposed to the diseases. In the times of COVID, nobody even came out on the road. But we doctors braved all this, saw so many patients, and so many doctors neglected their health, and they lost their lives, which is irreplaceable to the family. For the family, they are the most important person. And nowadays, people are going through so much physical assault, mental assault as it's happening, and we are all going through acute stress, and we all have poor interpersonal relationships because our time is not ours. We are exposed to bacteria, virus, fungus, protozoal, everything. And the psychosomatic diseases, as we know, we are the ones who are causing it. And we end up going into alcoholism, drugs, and suicidal tendency is maximum among doctors. And we are also affected by two more viruses, the virus called money and the virus called ego. Let me elaborate on it. Next slide, please. We really need to introspect. On the left-hand side, we have a column in which we have wealth, power, prestige, knowledge, security, and health. We have subjugated, our health is subjugated. We have given so much importance to this order which hardly matters in our lives. Don't know how much of each of this is enough. So we slog our whole lives to get all these things which we might not use in our life at all. Our work-life balance is affected so much that it really affects our health. Our health is subjugated. Can anybody remember the taste of the food you ate yesterday? I don't know what I ate yesterday. That is what each of you ask yourself and see. Remember, do you remember the taste of the food? The feel of the breeze on your face? The smell of a beautiful rose? When was the last time you all saw a butterfly? Other than the co-optex ad, a real butterfly in real life. We are missing out so much in our lives. We really do not know what we are missing until we really miss it. We are all the time, either we are working, earning, or dreaming to earn something which we never use. Next slide, please. Ideally, we should divide our lives, our days. Actually, in our days, we should divide it into 4 parts like this, I think. 25% is for me. 25% is for sleep. The rest 50% is to work and earn. At various stages of life, we can change this. But the percentage we allot for ourselves should never decrease in life. That is the only thing we have for ourselves. We should spend 25% of a fruitful day for ourselves first. Then we should spend the rest 50% for this world. And we should never compromise on sleep. As we know, lack of sleep leads to so many diseases. Next slide, please. Please look at this slide. I don't know whether we all remember the spelling of love, live, and laugh. We have literally forgotten these words called love, live, and laugh. It's partly our own making and partly the information assault. As Sir told and as Madam told, nowadays the patients it's a trauma because of the patients, literally. We are all traumatized by the way they talk to us and all that. They walk in with lot of information and it is difficult to remove that information from their brain, convince them that we are doctors and convince them to follow our advice. It's because of the society actually. We have all been commodified. And just look at this picture. Couples like this may become a rarity. Probably all of them, both of them are in their 7th or 8th decade. I don't think we will, I'm pretty sure many of us might not reach these decades. Instagram, Facebook, WhatsApp, Twitter, whatnot. As soon as they see, they are just posting our reports online, trying to get ideas, coming back to us again with the same reports. It is this profession is really doing a lot of damage to our mind and body. Next slide, please. Health is our fundamental right. We all know that. Health is taken for granted and its value is not fully understood until it is lost. In our 5th and 6th decade of life, like how I am, I realize I could have done so many things in a different way. It is too late to regret. The last few years, there has been an awakening among the younger generation, which is for the good. We had in WHO Health for All by 2000. What happened? Are we really there? Not by any chance. We are facing many, many new challenges. Next slide, please. My only advice is we should love ourselves first and get our priorities right. There is life other than this profession. I would suggest we make friends with non-medicos. It is a better thing. I have experienced this in life. We should not live to earn, but we should just earn to live. Eating a healthy diet, relishing the food we eat, eating less salt, sugar, and decreasing the amount of sadness in our life, and avoiding tobacco and alcohol. We should be active in our mind and body. Coming to regular health checkup, we should also advise our patients to have their vaccinations in their young age correctly. We should give them adolescent health education so that they get the correct advice and they don't follow whatever is on the internet. Being in the adult age group, when we are in the peak of our life, we should take care not only of our physical requirements, we should also make sure we have a happy life. And once we come towards midlife and we have what is called the midlife crisis, we should all learn how to handle it. Most important, a good body is a basic requirement for a good mind. And we should have regular intake of vitamins and calcium. Let us not self-medicate. If we get any cough, cold, fever, we just self-medicate because we don't want to go and visit and we don't have time or the inclination or the energy. We are so tired at the fag end of the day. We just self-medicate. We should avoid this. We should visit a doctor and be pampered for a change. Not only just us taking care of them, somebody else. They should also take care of us. Next slide, please. Next slide. We should avoid all the unhealthy habits, especially for women. We should definitely, how many of our lady doctors have undergone pap smears? I'm not sure. We advise for all the patients. Whether we ourselves have undergone those things, we don't know. For the men, I would suggest they undergo a prostatic specific antigen, and they also undergo all the regular checkups. They have good sleep, do proper exercises. Exercise need not be all should have a gym body and six packs and all that. Whatever they like, they should do whatever they like. Dancing, singing, gardening, yoga, meditation, going to a gym, walking, running, playing shuttle, playing tennis, playing anything they like. Just be active. Active in the mind, active in the body. And don't skip breakfast. Don't follow fat diets. Hydrate properly and vaccinate ourselves properly and support each other. We are all there for each other. We have literally, in the past 2 decades, there is such a drastic change. Patients don't treat us like gods anymore. We should first accept reality. We are being treated like commodities. How they go shopping to different malls, they go shopping to different doctors. They all are doing body shopping, and we should be ready and move our egos aside, answer their questions, and be able to handle all the situations in life calmly. And we should develop a support system, and we should develop friends amongst ourselves, keep our egos aside, and let's not enter into this number game. Life is not a number game. It's very, very lonely at the top. I hope we all realize it early. Better late than never, but earlier the better. Next slide, please. We should all undergo proper health checkups, especially mammograms, pap smears, and nowadays cancers is as common as diabetes and hypertension. We have to accept it. Occupational disease, we are bombarded on all sides. Doctors are a precious commodity. In coming days, I don't think many people want to become doctors anymore. Corporatization of healthcare has brought us to such a level that we have lost the art of healing others. We have lost the art of healing ourselves. I would like to end my talk by saying, physician, heal thyself. Thank you. Thank you for this opportunity.
Meena, Radha, thank you very much for that lucid talk.
Thank you, ma'am. Over to the chairperson to introduce the next speaker, ma'am.
Nancy,
Chitrakala, can you please
the CV.
CV of Nancy, ma'am?
Nancy is the speaker. Okay. Selva Kumar, right?
Yes, ma'am.
Meena, you introduce.
Yes, ma'am. Dr. Selva Kumar, sir, is an undergraduate from Stanley Medical College, postgraduate from Central Institute of Psychiatry, Medical Director, Appa Mental Health Facility. Over to you, sir, for your talk.
Thank you so much, ma'am. Am I audible?
Yes.
Very
yes,
clear,
Sir,
sir.
one
Audible.
second, if you don't mind.
Yeah, first of all, I would like to thank Dr.
Yeah, sir. Selva Kumar, sir, 1 second. 1 second.
Sure, sure.
Vasantamani, ma'am.
Yes, yes,
Vasantamani, ma'am.
yes.
Ma'am.
Am I audible?
Yes.
Yes,
Yes, ma'am. Yes.
Introduction of speakers and final word about the talk also, please, you take care, ma'am.
Yes, yes. Yeah, because I thought Rajaguru sir is doing lost in the session. So I have to introduce and then finally I have to conclude.
No, ma'am. This first session you cover, ma'am.
Okay.
Selva
Yes,
Kumar, sir, and
Nancy, madam.
Nancy, madam.
Yeah.
Okay, ma'am.
Yes.
Thank you, ma'am.
Yes, yes.
Are we good, ma'am?
Yes.
Yeah. Okay.
Yes,
yeah.
sir. Please, sir. Thank you.
Yeah. First of all, I would like to thank Dr. Radha Madhavi, ma'am, to consider me at this session. I am privileged, but she already, summed it up very well in her session. But I humbly request you, ma'am, don't summon me at a short time because so let's get into this topic. Can I see my slides, please? Yeah, it's the same topic. She already have summed it up very well. Next slide, please. Do I have to move?
Slide, next slide.
Yeah, exactly. According to WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or any ailment. Which means one has to understand that there are three components, which is the first and foremost physical health. Next comes the psychological health, and then comes as a consequence the social health. If we keep the first two things in a better manner. Next slide. So when it comes to physical health, we need to consider these two things. Probably my friends and respected seniors, you all might have been familiar with these two things: BMI, body mass index, and the waist circumference, with the hip ratio. And please consider yourself, please check yourself whether you are coming under this safety zone, which is the optimal thing. When it comes to BMI, your optimal range should be between 22 to 25 or 26. And when it comes to waist circumference, it should, better below than 0.5. Next slide, please. So coming to my arena, which is mental health. According to the World Health Organization, at least, over a third of people in most countries meet criteria for one or more of the common types of mental disorders at some point in their lifetime. And, global health estimate studies. This is a bit, outdated study. I gone into the recent study, but still in the recent study by 2019, I got some interesting findings, which says that at least our longevity we got extended. Previously, it was like, longevity in terms of life is 67 years by 2000. Right now, we have extended up to 73, fortunately. But there is another perspective. I'll come to that bit later. And when it comes to, global health estimate studies, one need to consider the disease burden. There is something else, called also this thing, global health estimate studies and global burden of diseases. When it comes to the global burden of diseases, you can say with substantial evidence that more than 1/3 of the global burden of diseases comes out of neuropsychological disorders. And this is not my opinion, this is actually a fact. Next slide. DALI. So what is this DALI? DALI means nothing but disability adjusted life year for a disease or health condition. Let me explain simply. For example, you consider a normal person like who born without any defects, who lived a healthy life, who does not acquire any disease or coma, whatever. He does not have disease. He lived a healthy life, and finally, when he gets aged, and when he reached his deathbed and he died, in a very natural way, that particular normal person can claim himself that he has lived his life. I hope we all agree upon this, because that is the way of living. And if we assume there are two other types when it comes under DALI. One is, the sum, you can calculate in two ways. One is in terms of mortality, another in terms of morbidity. You assume one person who died early. You just consider that the young person who died early, literally he has lost rest of the years. Probably he might have deserved to live. Likewise, when it comes to morbidity, you imagine another person who has extended his life, but I shall not say that he is fortunate, because if he is carrying one or two comorbid illness like diabetes or hypertension or cardiovascular disease, whatever, then the years of living, whatever he might have extended in terms of longevity, that doesn't matter. It doesn't make sense, because he has lost all those years out of that disability. Just because out of disability he cannot live a productive life. How can one be? So if one has to be productive, one has to be living, one has to attain peace, one has to be healthy, one should get rid of each and every disease. One should not remain disabled. So that is the point under this DALI. So longitudinally, global disease burden has shifted from communicable to non-communicable diseases, which means we have moved from the mortality to morbidity conditions, except for this brief pandemic, COVID-19 scenario, where we lost many lives. And like I said earlier, neuropsychiatric conditions has taken more than 1/3. Now you see the figure, it is closer to 33. The recent study, Lancet Psychiatry, it says that it is more than a third of population who is under burden of disability is contributed from the neuropsychiatric aspect. Next slide, please. So let's see some neuropsychiatric disabilities. You can call any number of neuropsychiatric disabilities. Most of the disorders you might be probably already familiar with, like unipolar depression, which may be called as recurrent depressive disorder, alcoholism, which is a chronic condition, which disables not only the person himself but also the family and the society at large. Schizophrenia again, bipolar disorder, alternatively, getting depression and mania, and rather in a regular or in a irregular fashion. Obsessive compulsive disorder and dementia, of course, followed by rest of the disorders, chronic conditions like epilepsy and this thing particularly developmental and behavioral disorders in children and adolescents. There are autistic spectrum disorders. They have to live with the previous slide, please. I haven't done it. So in the last line you can see like the self-harm, suicide and other sorry, can you go to the previous slide, please? Someone probably at their age, they're switching the slides a bit faster. The previous slide, yeah, thank you. Self-harm, suicide and other significant emotional or medically unexplained complaints, which can be brought under somatoform disorder. That somatoform disorder itself is a umbrella term. You can bring so many medical conditions, but actually it is a psychosomatic conditions. It needs at least a whole day to explain all those things, but let me give a glimpse, a slice of bread, bits and pieces upon this particular topic. When it comes to self-harm, suicide and the somatoform variety of disorders, all that does matters is the psychodynamics and the personality, the attitude, the behavior, the lifestyle of the person himself. And it is predominantly psychological and social surroundings, how it supports his psychodynamics. It's predominantly psychosocial aspect, not the biological aspect. The biology is getting compromised just out of the unhealthier psychology as well as the social circumstances. That brings out this somatoform disorder. Next slide, please. So what are the determinants of mental health? What determines exactly the mental health? Mental health is a state of well-being in which an individual realizes his or her own capabilities and cope with the normal stresses of life and can work productively and is able to make a contribution to his or her community. You have to listen, watch it carefully, because mental health does not stop with keeping your own self, your family, and rest of, if you're having a kind of industry or you are running a hospital, you are taking care of your employees, it does not end up there. You have to contribute to the community at large, at least when you grow up, not right now probably, and that defines the mental health. Then comes to the completion, the complete mental health. Until then we are little bit somehow somewhere we are compromising the mental health. I'm only talking about the mental health, I'm not talking about the rest of the things. And what else determines the mental health, how one can understand it? Mental health is a complex interaction of social, psychological. Social means the surroundings, psychological and this thing, and the biological factors. The biological means I'll explain it in the coming up slides, which determines the level of mental health of a person at any point of time. Next slide, please. So how do we understand mental health? Like from the social aspect, social perspective, from the environmental aspect, one can say like there are so many ups and downs, adverse events like unemployment, bereavement, loss, deaths, lots of deaths, and rest of the things. From the social aspect, it would be detrimental to rest of the domains. What are the rest of the domains? There are only 3 domains. One is the social aspect, another psychological aspect, and third one is the biological aspect, which is our brain. So social perspective, I have just you are seeing here. And from the psychological perspective, one can say like how a person keeps himself, like how he copes up with things, how about his self-esteem, whether he is an introvert or extrovert, or now he is having a low self-esteem, or whether he is having tolerance or not, what kind of attitude he is carrying with people around him. These things really does matters when it comes to working in a place, or even when it comes to keeping our family in a more peaceful way and carrying it on. And when it comes to the biological aspect, You can start it from genetics. When you assume someone who is already predisposed to some genetical diseases, you start it from Down syndrome. You start it from diabetes. There are a numerous number of genetically related predisposed conditions. You can get it any point of time in your lifetime. So apart from genetics, if someone is get inclined towards substances, they will become addict. And when it comes to other things like hormonal, if you take thyroid for example, you need to keep your thyroid and rest of the things. I don't have to explain it all. And hypothyroidism is very much related to depression, and you have to note it that. And when it comes to medical aspects, I really would like all you people to know that since this is a obstetrics and gynecological forum, I would like to make a point like there are certain psychological, comorbid conditions really in existence. I can name it, I can number it, like postpartum depression while, carrying a baby during pregnancy itself. Why? Because out of this biopsychosocial model, when someone is already vulnerable, getting married into a family, and even before she got adjusted, adapted to the circumstances, new circumstances, probably with her in-laws, the new surroundings, new relatives, she suddenly got pregnant. She is already under stress, and she develops depression. And so depression could be, even during pregnancy, immediately after pregnancy, during delivery. And most of the women, they somehow they get along with it if it is just like in a postpartum blue. But if it is more than that, if it is depression, definitely you need to refer them to someone else, because if you miss the crucial time, that period, probably they will slip into this postpartum psychosis, which might be very, very detrimental to the mother and the child at the same time. We are going to lose two lives. So this is my point here, and there are so many things when it comes to women. We'll leave it here because we are running out of time. So the treatment plan depends upon whether the occurrence is predominantly biological or psychological or social, so as to determine whether medicines, if it is biological, or counseling, if it is psychological, or both. In some cases, both are intertwined to be observed in the course of the treatment. And needless to say, when it comes to dealing the de-addiction clients, we need to involve the entire family members, because somehow out of expressed emotions, the mother will be supporting his son. There are a lot of family dynamics, frictions, and we need to look at all those things. And let us go to the next slide. Probably we can understand a bit more. So yeah, this is the thing I'm talking about. The first thing, biology, where you can be genetically predetermined so that a disorder may pop up later on in your life. And next comes on the left side, psychology, which is your mind. Mind means since from birth you got taught by your parents, then your teachers, then your society, then your peer groups, everything you are learning. And you becomes a personality, you carry some attitude, you can become a failure or you can become a success, it depends. And of course, another component, the third component is the environment. So this is a little bit complicated interaction. There are so much of dynamic things are going on and off. For example, if you take like in psychology, when you are born, you are not predetermined to born into some particular family. I don't believe in fate because we are in a scientific group, but still I would say like after getting birth, there is a saying in Veda, like from our Vedic period era, Mata, Pita, Guru, Devam. I hope you all understand. But I literally, I come to rather understand in a different way this particular thing, because every common people believe that Mata is the foremost God. Pita, Guru, Devam, because they are keeping the Devam, God, at the last part, because the chance has been given. God stands at the fourth as the person in the line. So, but I understand this in a different aspect, like what I have understand after coming to this particular field. Mata means Mata is our first teacher. First teacher. Pita means our father. Because during our attachment, during the breastfeeding time and the comfort the mother gives the infant, the child, that is very, very crucial. Because there comes the attachment, some kind of, psychodynamical problems which may pop up in future in terms of his, poor adjustment pattern, anxiety, so all those stuffs. And next comes father, Pita. When the child becomes a toddler, he would start imitating, learning from his own father, because for him or her, father is the only hero. Not from the movies they will imitate. Father is the real hero because they're traveling with their father on a daily basis. So I really wonder, I would request every father at their family to be very, very careful in front of their own children, even mother, how to behave, how to speak, how to conduct life on a daily basis in a healthy manner, so that they can learn willingly or, kind of unconsciously, it will get into their head. Then comes the teacher. When I say teacher, of course, we are only having teachers nowadays because they teach what is there in the textbooks. But in the previous days, good olden days, we had gurus. They taught us not only life, what is the meaning of life. They will, search and find out our skills, our potency, our capabilities, and they will guide us accordingly where we can shine. So we don't find, we are searching for gurus nowadays, and whatever we find, wherever we go, whoever claims to be a god man, it becomes a con man, all those things. So I got, a little bit deviated from the topic. I beg your pardon. Shall we move to the next slide? Yeah, I would really like to introduce this particular new terminology. This is a upcoming development in neuropsychiatry in recent years. Psycho-neuro-endocrine immunology. Sounds a little bit weird, but there is a communication here. It is a actual paradigm shift from a strictly biomedical view of health and diseases into a broader, holistic, interdisciplinary view. The key element of PNEI concept is the bidirectional crosstalk between the psycho, which means the mind, neuro, which means the brain, and the neurons inside the brain, endocrinology, endocrine system, the entire system, and the response from the immune system. Because one can imagine, you assume a patient, a chronic patient who might be under COPD, bronchial asthma, who might carry a diabetes, uncontrollable diabetes, or cardiac patient. They all might be, definitely be having a comorbid depression. And that particular depression, it is a fact. We have substantial enough evidence to show that people who are carrying 2 to 3 comorbid illnesses are getting much, much more compromised in this immune area. If you got your immune system very much compromised, and you can count your days, needless to say. Next slide, please. So, evidence-based practice. Why have I put this here? Because when it comes to psychiatric field, it is a little bit ironical, but I often found that eventually I started getting more number of medical fraternity, fellow people as clients, and I should really mention it here because out of the enormous population at large, even our own medical professions, medical fraternity people, it will be very, very difficult to make them understand what is psychiatry, what are those psychiatric drugs, what it will do to you, because even though they are under medical profession, they might be a specialist. They also carry the commonly observed social beliefs and systems and stigmas and all those prejudices. I'm not blaming anyone. I'm witnessing on a daily basis. And somehow we managed to convince them finally, because we are putting the evidences and we are putting the facts. A person from a medical field has to take the fact, but he is keeping the fact at stake on behalf of the stigma. He couldn't, he's struggling, he struggles a bit to come out of his own stigma. And the family is supporting his stigma also, because they are also carrying the stigma. That's why I put this here. So evidence-based practice in psychiatry. Let me be quick. Evidence-based clinical practice guidelines are strictly being followed in psychiatry to choose appropriate medicines and to determine the duration of treatment of a particular disorder. Existing guidelines recommends an acute phase treatment of up to 12 weeks, which means 3 months approximately, continuation phase up to 9 months, and maintenance phase up to 2 years for a first episode psychosis. I mean, psychosis means manic psychosis, depressive psychosis, or schizophrenia. Psychotic attack, psychotic episode. At the most, you treat him as early as possible. Probably he would recover within the 2 years. And if we fail, if somehow we interrupt this ongoing process of this 2 years of treatment, there are 3 phases involved. If we interrupt this phase, then there are possibilities that he will become a little bit chronic, so that he has to take another 3 more years of medicines, and the time becomes lengthier. Now you see, 2 to 5. Now he has to take 5 years of medicine. And even then, even if he has every possibility to recover out of 5 years of regular medicines, if he or the family somehow missed the medicines, or misguided, and they went to some other kind of wrongly guided faith healers and all those things, it happens, really, it is happening. So then they may probably fall into such a chronic category that they may have to take medicines for lifetime. This is the practical picture, practical scenario we are facing. Apart from medicines, therapies like cognitive behavioral therapy, interpersonal therapy, assertive community treatment, social skills training, and family-focused therapy are being widely used in conjunction with the above medicines. So I want you people guys to understand, really, medicines, when it comes to biopsychosocial model, predominantly if a person comes with biological need, we have to supplement with him with certain amount of medicines, which are all safer medicines. Even there are numerous drugs prescribed under guidelines. We can prescribe under pregnancy, during lactation period. So nothing to worry about. Many gynecologists and obstetricians are having this particular fear. I unfortunately has to come upon certain obstetricians who themselves are having depression during their pregnancy period and postpartum period. But yet it was so much of difficult for me during those times to make them understand. At least their husband understands and stand by my side and help them out. So please to understand. Next slide, please. So let us loosen up a little bit. It had been a serious session for a while. And social health, this itself, it takes a whole day to explain. There are various aspects under this topic. You can take any number of things under social, religion, philosophy, spirituality, politics, economics, you name anything. But let us keep it simple. When it comes to social health, because we are focusing upon our own medical fraternity's health, and we are right under social health now. We are covered already the biological health, we are covered up the psychological area, and we are going to cover this social health briefly. So let us start from the basics, ABCD. Basic needs, socially. We have been taught since from our childhood. We need food, we need some accommodation, shelter, we need clothing out of civilization. Of course, we have got so much of intelligence, and hence we need education, and then we should run for employment, and we need to have a family so that we can procreate. And please, my humble advice is, you just imagine the population previously, just before COVID, was 8.5 billion. I'm talking about the world population. Now it has come down to nearly 8 billion. So we have lost literally 50 crores of lives. So my humble request is, I'll tell you later. Let me finish this first. So once when you get into family, when you procreate, one children, no, he needs company or she needs company, another children, no, probably third one will be much better. That those periods are gone. At least I would really, pray that within our scientific community, I started really seeing things happening in a wonderful way that many of my colleagues in my own batch, they are having only one child. I should vouch for that. I should recommend that. I am also having one child, and rest of I recommend that because I'll tell you why that later. So after family, you can go for if you are successful in society, you can go for a little bit, sophistication, luxury, because you deserve it, you earned it, and then if you are still not fulfilled, you need some beyond your reputation. You need something to to feel some peace of mind, some fulfillment, completeness. You can go for charity, social services, to experience the life, what it is. You can call yourself like you have lived a life. You can successfully crossed all these phases in your life without much of struggles. I hope so, and I really hope so. But in reality, what happens when it comes to previously, we heard like we had been taught like as a word of mouth, through tradition, it comes like health is wealth. Am I right? Health is wealth. But what is happening? People around us in this modern era, they somehow mistook this thing as they started seeing wealth as health. It is really dangerous. It will definitely going to backfire upon them. And I would rather them to be take it in the reverse way. So they are keeping their social success at the utmost priority by betting their physical and psychological health at stake. This is a very wrongful way of approaching life, because I would rather come up in the reverse order. Psychological health, if one carries a sound mind, sound psychology, if one is very intelligent and one wiser, he knows how to take care of himself in terms of his is everything okay? Yeah. If one carries a sound mind, definitely he will take care of his physical body in terms of fitness. A sound mind in a very well-fitted body, fitness, definitely he might be knowing how to succeed, how to be productive, and rest of the thing will come and sit upon your lap as in terms of success. You don't have to run behind it. You know what I'm talking about. You just have to observe and start effortlessly. Everything will come. Everything will come behind you. So you don't have to chase. That's what I'm trying to say. So shall we move on to next slide, please? Yeah. This thing. I put this particular slide especially to give some hope, So we have spoken so much that why and how one should take the reverse approach. Everything is okay theoretically, but how practically it is possible? This is the evidence. This slide is the evidence, because this slide will tell you everything is possible if a human being decides to change himself. This is the evidence. Let me read it out for you. Neural plasticity is the ability of the brain or neuron to change its activity in response to intrinsic or extrinsic stimuli by reorganizing its structure, functions, and connections. You know what it means literally? If someone decides to change himself from intrinsic, which means nothing but your mind. If you think in a more your stimulus, I'm talking about your stimulus, internal stimulus, external stimulus. If your internal stimulus is much more in a more positive psychological way, then the change it will happen then and there itself from the inside. your brain will adapt according to your positive psychology, your positive way of thinking. The brain will adapt itself. It will develop connections, which is called pruning. So out of that pruning, if you start from inside by thinking positively, by keeping all the good qualities, good traits into your personality, then comes the external stimuli. If someone is already carrying some good qualities, some higher level of tolerance, some humility, some endurance to go through hardships, probably he will develop into a more mature human being. So under this neuroplasticity term, this is the evidence. So I strongly, beg you, each and everyone, to implement. So let's see how we can implement, because this neuroplasticity has wider implications beyond the self, by showing the possibility of changing not only one's own self into a better dimension, but when we get into our better dimension, it probably might contribute to the overall well-being of our societies at large. You know what I'm speaking about. When you become a better person, by following you, your family will become better, much healthier, and your neighborhood probably, who are working under you, they will probably get more healthier by their attitude and beliefs, and their lifestyle will change, and the life will become much more healthier. Next slide, please.
Sir, 5 more minutes, sir.
Yes, ma'am. I'm almost done here. Thank you for the 5 more minutes. And what is complete health? How to achieve complete health? So, in terms of priority, like we spoken before, the psychological soundness, which takes care of the physical fitness, and the psychological soundness and physical fitness will lead to a productive life, successful social life. And what else do you need? But after becoming settled in your life, if at all you feel some emptiness, if you feel some emptiness after getting everything in your life, and there is some more tip below that, what determines complete health? So when you feel emptiness, you have to understand that you haven't reached the complete health yet. Take my point. So then there starts this self-inquiry, which means self-research, which leads to self-realization. Where am I standing? What am I doing? How am I living? So when that comes into your mind, you probably start learning. After observing yourself, you start learning, and when you learn, that learning will push you to implement whatever you have learned into your own self to correct your lifestyle. Is this possible or not? This is definitely possible. So once when you start correcting your own lifestyle, and probably you might find your peace. The peace I am talking about, peace while living. You can claim yourself as a human being who is living in peace. I am not talking about the other thing, resting in peace at the deathbed. It's not that thing I'm talking about. Next slide. So we are almost here. We are done. Ma'am, do I have 2 minutes more? You said 5 minutes.
Yes, sir. You can wind up. If there is a video, is there a video, sir?
No, nothing like that. Just 2 more slides.
Okay, sir. Okay.
Yeah, thank you so much, ma'am. Thank you. Next slide, please. Yeah. Indian scenario when it comes to psychiatry. Although many effective interventions for the treatment of mental disorders are available and awareness about mental disorders has risen, the proportion of those who need mental health care but who do not receive it remains very high. We call this as treatment gap. This so-called treatment gap is estimated to be around 85% for low and middle income countries, which include India. So treatment gap is 85%. You just imagine, we are having around 135 crores of people in India, and out of 135 crores of people, nearly 1/3 of people are suffering from some kind of mental illness at one or other point of time in their life. Out of that, only 15% are getting the treatment. Rest of the 85% are left untouched. So again, the ironical thing is, out of this huge population of 135 crores in India, you see, for each 3 lakh patients, only one psychiatrist is available. And when it comes to psychiatry, a psychiatry need more hands, to work upon things, upon a client, because a psychiatrist can prescribe, but when you want to go beyond the prescription, beyond medicines, to do interventions in terms of psychological, therapies and all, into the family therapies and all, you need much more, experts like who are qualified clinical psychologists, who are qualified psychiatric social workers, and even when it comes to those professionals, those are all in the same ratio as like the psychiatrist. For each and for every 3 lakh patients, only one psychiatrist and mental health professionals is available. This is the scenario right now. Next slide. So of course, I need to, little bit, we can go through it. Recent developments in Indian government. To address these issues, the Indian government has launched the National Mental Health Program and the District Mental Health Program and spent about 300 crores until the current 12th 5-year plan. And I appreciate the next thing, which is the inclusion of mental health illness in non-communicable disease in the current 5-year plan and the new Mental Health Care Act, which is the outcome of this, because out of the United Nations conventions for the right for disabled people, since these people, non-communicable psychiatric people are coming also under disability, we finally found out this, new Mental Health Care Act. Previously, we had a 1987 Act, which was old-fashioned, outdated. Now, this new Act gives us much hope, and I really, convey my regards to the government for taking all these steps. And this is my last slide, ma'am. And thank you so much for giving this opportunity to raise my voice, to give some, glimpse, bit and pieces, maybe the tip of the iceberg, I would say. Thank you so much. Thank you very much.
Good evening. Thank you, Dr. Selvakumar.
Yes, ma'am.
Am I audible, ma'am?
Yes, ma'am. You are audible.
Ma'am, very much audible. Thank you.
I thank TNFOG organizers, Dr. Anjalachi Chandrasekhar, ma'am, Sambat Puri, and Vijay Lakshmi Gnanasekharan, and Meena, and Dr. Kurian Joseph, chief guest, for giving me the opportunity. And I thank all the speakers for this opportunity. And I like that Dr. Radha Madhavi madam, who given an elaborate thing about how to take care of our health. And I thank Dr. Selvakumar sir, who said the psychological aspect of health to be taken care well, because long back WHO said that social and psychological aspect of health to be taken care. So you cannot treat the patient alone. You have to go through the social and psychological. And many of the health system has been now changed from biomedical model to biopsychosocial model, and family to be integrated in treating every patient. And as per many pioneers, as they have said, health is wealth or wealth is health. But ultimately, health is only a wealth, because however wealth you have, you cannot buy health. As per Steve Jobs' statement, at the dead end of the bed, he said, I have earned so much in my life. Everybody is ready to share my wealth, but nobody can share my sufferings. And with so much of health, I cannot even buy a single day of my life to be extended. So if you have a healthy life only, you can have to live your life. And the same thing, many of the doctors who are all very, very busy practitioners, even those who are physically fit, and died at the age of 40 because they have not balanced their life between sleep, exercise, rest, and learning. Many learned their life, but many failed to live in their life. So as a doctors, it's definitely a high time to take care of our health. So it is the time, because everybody's statement is உங்கள் ஆரோக்கியத்தை கண்டிப்பாக நீங்கள் தான் கவனித்துக் கொள்ள முடியும். அடுத்தவங்க உங்க ஆரோக்கியத்தை கொடுக்க முடியாது. So everybody, as Radha madam said, we have to balance our life to 25% for sleep, 25% for exercise, and 50% for work and earning. So, as per Dalai Lama's statement, doctors, it actually fits into doctors' life only. Doctors fail to live in the past, present, and future because most of their life they earn and earn, and in their health will be spoiled. And with this earning, they try to get back their health, but ultimately fail to get back their health and live with the ailments without enjoying anything in the past or present in the future. So definitely we have to take care of the health. It is really a high time. As Radha Madam said, it's really we have to take care of health. This should be focused. And taking care of health, definitely it should be converted into a biomedical, social, and psychological model. And psychiatry should be taken into well care because now, as God said, single child now may be good, but with single child, there is no compromise on the life. There is no give and take policy. There is no person to teach how to live a life in a childhood. Definitely, every child needs a friend, an accompaniment to share their views. A parent cannot share the child views at their own age. So, at least combined family, which is previously we are living, not a nuclear family or a single child family. Definitely, and potentially health is more important. This health should be started from the intrauterine life itself. If it is a baby, is a healthy baby only, they can develop healthy, they can enjoy their health till their last. And if they become or a genetically compromised baby or a preterm baby, they cannot enjoy their health, or a thought disease, something, some congenital anomalies, all these persons cannot enjoy their life. So we should take care of all these things right from the intrauterine, because being an obstetrician and gynecologist, I'm saying this, the health should be taken right from intrauterine, from the mother to the mother and to the baby, and every day's life. That is, as Madam said, it is really very late. Then only we are realizing that we have to take care of health. But it should be taken care well ahead in the childhood itself. They should give them in the protocol itself. There is a time to play, there is a time to read, there is a time to sleep. Because many of the doctors who slept less than 6 hours has lost their life at the age of 40 and 50. That being in the records. So it's really great. I thank once again Radha Madam and Dr. Selva Kumar, who has given a very detailed things about this. And next, I introduce Dr. Nancy Madam, who is going to talk about how you can plan your future ahead. So, Madam, who's been a president of Erode Obstetrics and Gynec Society of Tamil Nadu, completed his MBBS in Tirunelveli Medical College, did his DJO in Stanley Medical College, is working as a doctor for the 3 decades, and retired as Deputy Director of Family Welfare in charge in Erode. And previous post held by Madam is past president of Erode IMEA and Government Doctors Associations, and past convener, chairperson for Women Doctors Wing and Finance Committee. And Madam received so many awards: Best President Award from IMEA TNSP, Appreciation Award for Facebook activities, and Best Doctor Award in other things. Let us welcome Madam. Madam Nancy, Madam, over to you.
Thank you, Vasanta Mani ma'am, for a nice introduction. I thank Dr. Vijayalakshmi ma'am and TNFOG for giving me this opportunity to present this plan, your future ahead. Can I have my slides, please?
Ma'am, you can able to see the slides?
No,
Yes,
it is like a...
But it's all the slides are in single.
1 second.
Put it in slideshow.
No, it's not going. 1 second, I'll stop this share. 1 second. 1 second, ma'am, please, if you don't mind.
Yeah. When Vijayalakshmi ma'am asked me to talk about planning your future after retirement, that word is itself is a misnomer for doctors, I think. Retirement is a major accomplishment in everybody's life, isn't it? But as doctors, we never think about retirement. We will practice as long as we can, irrespective of the age. In other profession, people go for work at a particular time, take leave at a particular time, and retire at a particular age. But as doctors, we have no time limit for practice or retirement. So planning your future ahead should not be planning after retirement. We should get our work segregated to restrict your practice and plan your future. In our profession, only persons attached to institutions in government or in private institutions will have a retirement dates. Others won't have any retirement at all. As long as our mind is sane and our physical fitness is there, we will practice. We have seen doctors practicing up to their last day of life too. So post-retirement plan is a misnomer. Priya, energy, slideshow. Priya?
ஒரு நிமிஷம் ஹேங் ஓபன் பண்றேன் மேம். ஒரு நிமிஷம்.
Okay.
மேம் வந்துருச்சா?
வருது. ஸ்லைட் ஷோல போடுங்க. Yeah. As doctors, do we have a retirement? That's why in government or private institution, we will have a retirement date. Even in institutions, they will be having post-retirement post, and we will work till we are fit. Surgeons will retire little early because of their inability to perform surgeries, but physicians will practice for up to their sane physical fitness. Next. What are the strategies for the doctor's retirement? Somebody will opt to retire early, somebody may delay retirement. Those who want to quit profession, they will be having low job satisfaction, medico-legal issues, health concerns, and financial troubles. Those persons may opt to retire early, but most of the doctors will delay their retirement because of career satisfaction, institutional flexibility, feeling responsible for their patients, economic reasons, and lack of interest outside of medicine. That is the main thing. Many of us will fall in the second group only, I think. How happily we are going to face it and cherish the moments of our future as grannies is $1 million question. Next. How should be the retirement? It should be a major accomplishment of our life. It should be comfortable, flexible, and easy to follow. We will be dreaming of endless days in traveling, golfing, reading, seeing movies, or napping, whatever. We consider it as a reward for decades of hard work and dedication to our practice. Next. But what are the challenges before us to get retirement? Will I have enough saved to live comfortably in retirement? We'll be having a thought always, our financial status will continue to have a comfortable life if we retire very soon. What will happen to me if I run out of money? If we become penniless, to whom we can go and get money? We will be in a helpless position. What will I do if my health declines and I need more money? These are all the challenges restricting us not to get retired at an early date. Next. We have to plan for a future. So in that case, we must see so many things. At what age we can retire? How long will you live in the retirement age? As the longevity is increasing, whether we will live up to 90 years. What will our health be like in the retirement? Whether it will be healthy or we will be always under medical care. What kind of lifestyle do you want in retirement? A relaxed thing, or a luxurious thing, or a committed thing to some other thing? How much will that lifestyle cost in 20 years, 30 years, or 40 years? How much will you need to spend on necessity? How will your investments performance? So all these things will make us to plan whether to get retired or we have to continue our profession. Next. But all of us can't have a same strategy. Every person will have a different attitude and different atmosphere. It will not be alike to all. You are still paying off your debt once you retire, such as a mortgage, car loan, house loan, or marriage loan for your children. You may enjoy expensive recreational activities like some going for a club or having some other activities. You incur major health expenses as we are getting a CABG and all in 40 years. We may incur more expenses. You may plan to travel extensively. For this, your plan may differ. Next. You spend too much. You may be unemployed for a period before retirement. You seldom save for your retirement. You are earning and spending then and there. You may be disabled. In age, we may get fractures or some other disease may make you handicapped. You give money to your children for their settlement. You care for your aging parents. As even at the age of 60 years, we may be having our parents at the age of 90 years. So we are having so many commitments. Next. So how much income we are getting from other sources after retirement, sources of income? What are the debts? What are the future financial obligations? Your desired retirement lifestyle, wherever you want to live, in a village or a metro or a corporate place. Like most people, doctors plan to maintain the same lifestyle in retirement that they had while working. As a doctor, you must have a car, you must have a posh house, you must have an air-conditioned house. You can't sit in a hut or a farmhouse. So you have to maintain your same lifestyle. All this complicates their approach to retirement plan. Next. Reaching retirement is a blessing or a curse. We don't know. On one hand, after decades of following other people's rules, there is a sense of relief that you will finally get to live the way that you want to do. So that is a blessing. On the other hand, it is easy to feel lost. After retirement, we may be fearful, sad when reaching this important milestone. You know logically that you are retiring from work, not life, but it doesn't always feel like that. After retirement, many of the retired people are in a depression that they have come to an end of life. But go out into the world and meet interesting people. After decades of work, learn to renew, explore, travel, inspire and relax. Embrace life with energy, creativity and passion. Don't let yourself get bored or boring for that matter. Next. For that, 10 commandments from my side. So celebrate your retirement. You start your retirement day with a good celebration, calling your friends and have a party and convey them that you are going to retire. Retirement means a surgeon can partially retire as a consultant in the OP alone. He can't perform surgeries and he can't go for all sick cases in obstetrics. You can go for high-risk cases. You can confine yourself with some OPD and small procedures. So it's also an retirement. You need to be at home in a bed. That is not the meaning for retirement. You are restricting your practice and getting some time to enjoy your life at the age of 60 and above. You set goals. Exercise regularly and stay active. Have an enjoyable hobby. Plan socializing activities like traveling, parties, and get-togethers. Replace work routine with new routines. Follow your passion. Get high-quality sleep at night. Communicate with partner and family about your ideas. Finances align with your plans. These are the 10 commandments, not only for the people, those who are going to retire. For every doctor, it will be useful if they have these 10 commandments in their life. Next. Exercise, as doctors, we know the benefits of exercise, but you should do a regular exercise which is possible for you. Needing to, as Radha Madhavi has told you, needing to go for jogging or anaerobic exercises. You can do whatever is feasible for you. You can go for a walking in the road or a park, or you can put an age in your terrace and you can go for a walk, or you can sit in your room and do some yogas. Whatever is feasible, whatever is applicable to your health and your age, do a regular exercise and make you fit and active. It induces endorphins and make your mood happy also. By becoming happy, you will make the atmosphere also very happy. Automatically, your sleep will also be perfect and prompt. Next. Hobby. This is the one thing when you want to have a relaxation. For busy practitioners like obstetrician, we won't be having any time. We will be munch things, whatever the ayah or your mother-in-law gives, and you will be busy in your practice. After retirement, cooking alone can be a wonderful hobby. It's very nice to stand in between, behind a kitchen burner and cook small things to your husband or your child, though it is tasteless or smellless. That thing will give you a mind relaxation. Don't think cooking as a burden or it's a womanly thing. It's a very good hobby to relax you at any time. Intelligent into any new hobby. You may not be interested in gardening, but at least pour some water to the pot that is sitting in your portico. When it blooms with the rose, your mind will get a very good relaxation. Likewise, cooking, painting, stitching, reading, whatever is affordable by your time and thing, you do a new hobby. Daily routine of this new routine will give immense satisfaction. Next. Socialize your activities. Our doctors are always, I used to tell, 2 roads, 4 walls. From my house to my clinic, these 4 walls, 2 roads, there 4 walls. So we seldom have socializing activities in our busy practice time. We will be always with the patients and almost we will be not knowing how to socialize. So gossip after a morning walk in a public park will be the ideal socializing in our area. When we go for walking, we will be seeing all parties sitting in the bench in the public park and they will be talking with a very much vigor and they will be laughing like anything. I always envy them because we don't have such companionship because we never socialize. After retirement only, we are looking for persons around us to socialize, but they will make us as a celebrity and they won't come near us. So gossip is a good socializing activity. Make it possible. So Vambu Besaras Nalada. Plan for periodic dinner or lunch outs with friends and relatives. Once in a month, go to your friend's house or call them for a dinner or something. When you are socializing, your burden will be going out. You will feel so free. Arrange for small get-togethers with peers and nears. You make get-togethers for your classmates. After 40 years of age, people are having get-togethers with their schoolmates, college mates, and whatever thing, working mates, playing mates. So arrange for small get-togethers. Travel according to your convenience. The traveling is the best thing to socialize because when you are going for different places, we will see the different culture, food, environment, and nature, and your mind will be definitely free from all stress. Next. You must have a good rapport at home because all these plans, everything needs the help of your spouse and the household. Your children should cooperate with you. If you want to sit and stitch, they must allow you. If you are not, if you want to go for a travel, you need some finance. It should be a combined effort to plan for your this recreations and hobbies, everything. So you discuss everything with your spouse and get your family's cooperation. Next. So retirement is another new chapter of life. I hope you enjoy it with relaxation, good health and fun. The old chapter is closed today. A new journey is about to begin. Embark on it with a deep breath. Make sure you will enjoy it all. All the best. Thank you. Thanks for giving me this opportunity, ma'am. Vijay ma'am has asked me to talk about this topic because I used to travel a lot. I will work for 3 months, get money, and I will go for a mega trip. If time permits, I will go for small trips in and around E-Road, and when nothing is there, I will go to our farmhouse and enjoy the thing. So traveling and socializing will make your mind so free and make your retirement age stress-free. So I didn't talk about the financial constraints and the planning further because one expert is going to talk about you. Already physical health is very well talked by Radha Madhavi, and mental health is elaborately talked by Dr. Selva Kumar. Financial thing is to be talked by some other person. So I have given almost a social health. Thank you.
Thank you, Nancy madam, for your elaborate lecture on this how to plan your future ahead. So planning your future ahead is definitely a milestone in everybody's life, whether they are a student or a college student or a beginning of their career or a mid-career or a retirement. But as far as me concerned, I think for doctors, there is no retirement. As long as you are healthy, your life is always a balance between work, exercise, and other things. And I have seen many of my professors, like Dr. Anjalashmi madam and Dr. Cynthia Alexander madam, they living their life, enjoying their life, and whatever their expectation they are having, they're only fulfilling their life only after their retirement. I think Dr. Anjalashmi madam will definitely agree with me. Many of them living their life only after their retirement. But we have to plan our life even when we are earning, because there should be always a balance between earning, life, future plans, and family plans. So without wealth, health has no role, because all your health will be spoiled for earning the wealth. And without wealth, you have a, if you have a health, without health, if you have a wealth also, all your wealth will be spent to bring back their health. So definitely, Nancy madam has brought this, how to plan your life ahead. So I thank each and everyone for this opportunity. So everyone should balance their life between earning, exercise, psychotic, social well-beings, and everyone should learn how to balance between the needs and necessities. So many of the time, it is an absolute necessity. We have to put your strain. All needs cannot be satisfied. There should be a part where we have to compromise on certain things. So mental well-being. So mental well-being should have a satisfaction, whatever we have. This is for enough. If you have that mind, definitely health will stay with you. Without health, you cannot enjoy anything. Your wisdom cannot be explained. You cannot manifest your art, strength, intelligence, anything. Because without health, you can't do anything. Even if you have crores and crores of wealth, it cannot be utilized for anything. Ultimately, you don't have a better health. So everybody should take care of their health. Definitely, all our viewers and delegates will, from today onwards, they should learn how to plan their life, how to give importance to take care of the health, how to balance between work and exercise and sleep and other things. Definitely, I wish each and everyone to have a very good health and successful life. Thank you for the opportunity.
1 minute, ma'am. Our future generation is not at all interested in taking obstetrics and gyne as their optional PG, because looking at us, they are thinking that no obstetrician will relax. They won't enjoy life. Though they are minting money, they seldom enjoy. So we should set examples to tell them that we can balance practice and enjoyment. Then only they will come into OBG practice.
Yes, ma'am, definitely. Many of the younger generations of doctors not willing to take surgical field, especially obstetrics and gynec field. So we should say that stress is not for everyone. How you take things, you can work without stress. That we have to teach them. Then only they can take up that course. And in future we have many obedience. And I think Dr. Kurian Joseph and Dr. Andalakshmi Chandrasekhar Madam will enlighten on this and end of the session. Thank you.
Thank you, Vasnamani ma'am, for that excellent sharing of the session. And now I would like to invite Mary Ann ma'am, President Nagarkoil on Obstetric and Gynec Society, President Rotary Club District, and also eminent speaker in various national conferences. And she is ICOG registered faculty and she is member of many FOGSI committees. Over to Mary Ann ma'am and Preeti ma'am. Preeti ma'am is Associate Professor, Department of Obstetrics and Gynecology, Christian Medical College Hospital, Vellore. She is a fellow in Obstetric Ultrasound and Fetal Medicine, University College London Hospital, Secretary Vellore Obstetric Gynec Society. To take over the next session and introduce the speakers, Professor MC Patel sir and Rajguru sir. Over to you, ma'am. Mary Ann ma'am.
Can you hear me?
Yes, very much audible, ma'am.
Can you
Hello?
hear me?
Yes,
Hello?
very much audible, ma'am.
Hello, am I audible?
Yes, we
Am
can
I
hear you,
audible?
ma'am. Yes, ma'am, we can hear you.
Okay. Good evening, everybody. To all of you here. I'm to President of ma'am and Secretary Dr.
Ma'am, Mary ma'am, your voice is not at all clear, ma'am. I think internet issues. We're not able to hear you. Mary ma'am?
Everybody's hello.
Mary Ann ma'am, your connectivity is not good, ma'am. Mary Ann ma'am.
For the committee for C 2011.
Meena ma'am, I think ma'am is left. Meena ma'am?
Okay, Mary, Meena, Priya, it's okay. Patel sir, a very good evening to you.
Yes, good evening.
Over to you, Patel sir.
Very sorry for the net this disturbance
No,
in your introduction, sir. You are most welcome to Tamil Nadu for the Tamil Nadu societies. Thank you so much, sir. Mary Ann ma'am, because your connectivity is poor, I intervened. Kindly excuse.
But apology in advance. Here is also rain, and due to some connectivity issue, it is all likely that my video may not work. But am I audible?
Yes,
yeah,
very
sir,
much audible, sir. Very clear voice.
Let me share my screen.
Yes, sir.
So please allow me. Is it seen?
Yes, sir. It's getting shared, sir. We can see your slide, sir.
Okay.
Can you share it in the slide share mode, sir?
I am doing, but here there are so many icons. How to remove those icons?
Sir, lowermost portion of the screen, you can see the hourglass kind of a thing.
No. There are so many icons with all these participants.
Yeah, that's a lowermost. You come down, sir. You come down lowermost portion.
And because it is difficult to read my slide also. So how it can be minimized? Anyway, let me start. So
Sir, you can go up animation next one slideshow also you can go, sir.
no, but maybe my slides are not moving due to this all icons.
Sir, please close it and restart, sir. Again share it, it's better. Maybe it's hanged.
No, it is not hanged. Is it seen now?
It is seen, sir, but it is not moving and it is not in slide share mode, sir.
So, there are so many icons obscuring my screen. So that is the problem. How should I do that?
Yeah, correct. Now it's correct.
Moving, sir.
Now is it seen full screen?
No, sir, it is moving, but not seen in full screen.
Then there is some problem because I have made it full screen in my computer. It is seen full screen, but it is not seen full screen in your computer, no?
No, sir. Sir, maybe we can close and open again, sir.
Okay. Stop sharing and again share screen. Now, is it full screen?
No, sir.
No, not yet.
So what we'll do then? Because I was out of this sharing and again I have logged in to share. But
Priya, any help can be done to sir?
No.
Ma'am, is it a 57%? Ma'am, asking to increase 100. So is it the slideshow model is a 57%? You can increase to 100, please.
Priya, ask Chitrakala to help him.
Ma'am,
No,
she's traveling.
Ma'am, we can't help like that, ma'am. The only way is we can share it from our end.
The sir can send his slides by mail to Chitrakala.
No.
Ma'am, 1 second, ma'am. Sir, it's in 57%, sir. You can increase to 100 and go to the slideshow.
But how it is to be increased?
Here, no, 57% is showing, no? You can go to 100 and the after animation, the slideshow is there, no? Just click it. Yeah. And you can go to slideshow.
But it won't work much.
Okay, you can, sir, after animation, 1 second, sir. In the upper side, go insert design animation slideshow. You just click the slideshow, if you don't mind.
Please listen me. I have obscured so many slides and with this, all the slide will be seen.
Oh,
so
okay.
if it is full screen, then only it will work. Because it will be confusing for you also.
Sir, can you move the cursor to animation, next to animation slideshow?
How to do it?
Sir, your cursor is there
In
now.
the top left corner. Top left corner. Tell him.
There is nothing on
top
top.
left corner. You have this written over home, insert, design, animation, slideshow, review, and view. In that slideshow, sir.
Nothing like this. Here only mute, start video, security, participant, chat, new share, pause share, remote control.
Sir, you are talking about the bottommost of your screen, what you're seeing. What we are telling is in your presentation, your thing, we're able to see your cursor. You just move your cursor, sir, it is moving. Slowly you move it.
But this way.
Yes.
But then again, there are some slides which is not to be discussed. It will also come.
It won't come, sir. Don't worry. It won't come.
Ma'am, 1 second, ma'am. Sir, You just go to the home, insert design, no? The saving, no? The home page first. Home, insert design, animation. Upper. Yeah, animation. Next one, slideshow. Go to slideshow. Next, click it.
Yes.
Yeah, from beginning.
I have clicked it.
Yeah, just go to from beginning. Is there no?
See, under that, no, you have the from beginning.
From beginning.
Under the slideshow. Below the slideshow.
One person at a time. I am confused.
So
Because
here from beginning is showing, no?
In my screen, it is full screen. But
Your screen, sir, you just from beginning. The slideshow you clicked, correct? You can just go to the from beginning.
Second row.
Yeah, you just go up, sir, please. Yeah, you can come to the left.
I did it.
Yeah, your left first one. Your left hand, the first one from beginning is showing.
It is not moving here then.
It's moving.
Second row, sir. Sir, second row. Come to the second row.
With slide show, it should be full screen, na?
Yeah, it will come as a from beginning, it will come as a full show.
Yes. I have started with my first slide. I have did animation. Then
slide. No, you can go to from beginning. The next row is showing no from beginning onward.
With first slide, na?
No, go to up. The home page next.
Priya, ஒரே நிமிஷம் Priya. Now we're going to try.
From beginning. From beginning, sir. You just click it, the first slide. Please click it. First slide, you can click it inside. Just double click.
Not working.
Sir, come down.
Sir, double click that one, sir.
Is it seen?
Click. Sir, click slideshow.
I have did it thrice.
No, you click it. Now come little down and go to the left corner.
Then
left corner. Yes.
Yes, this one. Click.
Is it seen full screen now?
Yes, you click it. You have not clicked, you have highlighted.
In my computer, it is seen full screen, madam.
That is good, but you click it so that we can see full screen.
But I have already clicked once.
Double click.
I have did double click.
No, double click it immediately.
Is it seen full screen now?
So otherwise you just press F5, sir. It will come.
F5.
F5.
I did it, but it doesn't work then.
F5. If the slide shows from beginning, it will come.
I did that also.
Sir, if you don't mind, you can put it in the group. Your slides, I will present it.
The same problem, na?
No, you can stop sharing. You just WhatsApp me in the group.
But one can run, it will not
otherwise,
be to me.
Vijay ma'am?
Control of with me only, then only it will be effective.
Yeah. It will be better with you only, sir. I agree. But sir, one more try, sir. You are now there in the beginning, no? Yeah. Why don't you bring the cursor fully down, sir?
No, again, lead me, guide me. I have come again.
Sir, you increased from 57 to 100%. You increased.
Here in my screen.
Just by that side, there is a sandglass-like picture where you increase the percentage. Just next to it, there is a sandglass. Come down, sir. Come down.
Madam, I have increased it up to 98%.
Yeah, correct, sir. Just by its left side, left to the 98%, there is a sandglass picture. Click that.
But in my screen, it is seen full screen. Does it seem in full screen of your screen?
Sir, what you done now, 98%. After that, the sandglass, you click it, double click, sir. it will come. Double click. Yeah, correct. Double click, please.
98 and I have.
No, yeah, click it. That one. What cursor is there? You just click it.
But madam, in my screen.
No, I'm not talking about 98, sir. After that 98, one cursor is there. No, you just double click it.
I did it in my screen. It is full screen, but
yeah.
Not applicable.
Okay, sir. Sir, there is something wrong. I think we need not worry about it. The content is important. Even without slideshow, we are able to see it. You please go ahead, sir. Only thing is, you have to change every time. You have to change the slide separately. No problem, sir. You please go ahead.
But I have changed it to second slide. Does it seem there?
You've changed the second slide.
Screen is seen. As Vijay Lakshmi said, you go to the second slide.
I have made it second slide. So
there's a Dr. Bharati Ravi who wants to say, can I help? What others,
yes.
Everybody else keep quiet. Let us say what madam is going to tell. Please go ahead.
How? Because if my slide is not seen there, then how should I go? Because in my
no, we are able to see the first slide, Dr. MC Patel, consultant obstetrician.
In my computer, it is second slide and it is not seen there.
Okay. Then, sir, the only way is you have to close it and you will have to come back again. Probably you log out and again log in, sir. That will be better.
So I am stopping sharing. I am leaving and I will.
Sir, you can get somebody's help if somebody is around there.
No, sir regularly does presentations, ma'am. So there's something else that is wrong. Not that he doesn't know.
Okay.
So let him log out and log in again. Has sir logged out, pa?
Illa, ma'am.
Or go to the next speaker.
Ma'am,
yes, ma'am.
Call pani.
Priya,
Wait for another
call
5
pani
minutes.
coordinate panna.
Cherry, ma'am.
Mary, madam.
Preeti,
Mary,
ma'am.
madam.
The next speaker, ma'am.
Dr. Preeti, madam, please, can you introduce the next speaker?
Right, left,
Ma'am,
right,
you
one on
available?
the left. The left.
She is there, ma'am. She is there.
First left.
Request Preeti, ma'am, to introduce the next speaker.
Yes, ma, she will introduce. Dr. Preeti. You're not audible.
Unmute yourself, Preeti.
You're unmuted, but you're not audible still. Maybe the volume has to be turned up. Dr. Preeti, if you don't mind, shall we introduce? By which time you can go ahead. Meena, please, can you go ahead?
Yes, ma'am. As madam is in labor ward duty, she is not able to join the connectivity.
Proceed.
She's there, ma. You go ahead and introduce, pa.
So I
Meena.
would like to introduce a speaker, Mr. Rajaguru Muthusamy, who is going to give us an idea about financial planning. So he's got 32 years of experience in domestic and international experience, professional in the field of personal financial planning. And he has worked in Jupiter Wealth Managers as a chief executive since 2009, director, Skiltra, ex-director, Ledra India. And he has been there in NISM certified mutual fund distributor, NISM certified equity derivatives transfer. Over to sir for his speech on financial planning for us.
Thank you.
Can you please
madam.
share the slide, sir?
Yes, I will do that. And my sincere thanks to TNFOG and Dr. Vijay Lakshmi for giving me the opportunity to be part of this office forum. Are you able to see my screen?
Am I audible now?
Yes. My volume.
Yes, is it okay now?
Yes.
Okay. Are you able to see my screen now?
Yes. Yes.
Okay. Okay.
But not in the slideshow.
Now, I just.
Yes, sir. Yes.
Yes.
Okay.
Yes.
Thank you.
Just 1 minute, Dr. Mr. Rajguru sir, 1 second.
Yes,
Meena,
please.
kindly call Patel sir, Meena, and just to ask sir to hold on. Please request him. Please request him. Okay, Meena? Yeah.
Okay, madam.
You go ahead, Rajguru sir.
Okay. Thank you. Thank you, doctor. Okay. Good evening to everyone. So,
What happened?
let me start with, actually, without Thirukkural, you will find everything, every solution in Thirukkural. The first one is Alavarindu Valadan Valkai Polapola Illahi Tondra Kedum. Okay, the prosperity of him who lives without knowing the measure about his prosperity will perish, even while it seems for others it is continuing. So everybody is wondering, right? And when I talked to Dr. Vijayalakshmi madam, he said you should cover tax as well. So I just added few more additional slides.
Left.
Everybody is wondering, how to save maximum tax, to reduce my tax, or where should I invest? Should I invest for?
நீங்க ஏன் ரைட் போனீங்க? தெரியல எனக்கு. அதான் தெரியல. எனக்கு தெரியும் நீங்க ஓட்டும் போதே தெரியுது.
Hello. Okay. So whether to invest in PPF or fixed deposit or buy insurance or mutual fund, and what is in it for me? And what is the magical number? Everybody, when I talk to them, they talk about 80, 80C, 80D, 80CC. There's a magical number of 80 related to tax. And always you'll be wondering, how come I pay more tax than my friend who earns more than me? And how much I really need to pay tax? Am I paying, overpaying, or am I underpaying the tax? So just give you a basics. So you should know about your tax deductions. I just want to rush it because we'll always have, if you want to have one-on-one, we can continue to have discussions. For want of time, I just want to cover the basics. So basically, every individual has the exemption. The first one is called 1.5 lakhs. You can invest in any one of these instruments. Could be your PF, or could be your housing loan principal payment, or it could be children's tuition fees, or it could be a 5-year fixed deposit, or it could be ELS as nothing but an equity linked savings scheme investing in mutual funds through stock market. Then your PPF, that is public provident fund. Of course, the life insurance policies. These are all popular instruments under Section 80C. The second one is Section 80CC is predominantly a pension product, but it is not well used in India nowadays because not many products are available in this segment. Section 80CC is predominantly for the central government pension scheme. Currently, from 2015 onward, we have exclusive section for NPS, where you get the additional tax exemption. This is applicable both if you choose a old tax system or a new tax slab. Both it will be available. This exemption is available. It's called a new pension scheme or national pension scheme, you can call it. So it's 50,000 rupees is a tax exemption under this scheme. This is exclusive. The second one is a very popular one. You all, because you are professionals, doctors, so you'll be knowing about all your health insurance, which also gives you the exemption. If it is a self and spouse, we give you 25,000 rupees as a tax exemption. If you have a dependent parents, if they are senior citizens, you have 50,000. So under this section, you will have, and if you have disabled associate in your family where you want to take care of your ailment, that is also you have. And maintenance of medical treatment for disabled and dependent also, you have separate exemption. This is basically a various heads under which you can avoid tax or you can reduce tax by investing equivalent or more than limited money in this. So let us talk about taxation. I think predominantly most of you, if you crossed more than 30
Sir, can you be a bit louder, sir?
Okay. Is it okay now?
Yes, sir. Can you please come near the mic and speak, sir? Its
Yeah,
voice is very feeble, sir.
okay. How about now?
Better, sir.
Is it okay? Okay.
Yes, sir, better.
Thank you, madam. Basically,
thank you, sir.
Each one of you, when you look at it, at the age of 30 or 35, or if you crossed 10 lakh of income per year, you might have exhausted all the sections, 80C or 80D, because most of the vehicles are used in the early stage of your career. And there is limit is always, last 15 years, there is no change in these limits. So predominantly for you as a professional, you should care about other taxations. The one is the capital gain tax. Any investment you make in cryptocurrencies, the buzzword of today's, and real estate, or even in equity, that is through stock market. Either you purchase the stocks or you invest through mutual fund or buying of gold. All of them have a capital gain tax imposed on your gains which you make on these investments. The cryptocurrency is nothing but 100% taxation. Real estate you get around 20. Equity is long term means 10, short term is 15. The defined short term or long term is nothing but 1 year. More than 1 year, if you are holding that investment, it is called a long term capital gain tax. And gold, of course, you should hold it for 36 months. So beyond 36 months, it's called the long term. There are only few instruments are left out as a tax free as of now. One is the PPF, still continue to have enjoy the tax benefit while investing as well as while accumulating and while exiting. Still this enjoys a tax, total tax free. Second could be your insurance products. Select insurance product because some of the instruments under this insurance products are come under tax net nowadays. There is a sub limit we call it. For example, ULIP you can't invest more than 2.5 lakhs. Anything investment done beyond 2.5 lakhs, it will warrant tax on your gains. That is basically a maturity time. The third one could be a partial tax. The investment which we talked about, the NPS, up to 60% you can compute, take the computation model. Suppose if you're investing, say, 50,000 rupees for next 20 years. Let us assume your accumulated wealth could be 50 lakhs. 60% of that amount, that is nothing but a 30 lakhs, you can take the money out without any tax implication. The balance 40%, you have to buy only an annuity product. The annuity product is nothing but lifelong fixed deposit, you can take it that way. The interest rate is fixed on the day of your investment, and you will enjoy that interest throughout your lifetime, irrespective of the change in the market conditions. And the capital will be returned to your nominee after you. Predominantly, annuity rates currently in India is around 5.5 to 6. 5 years ago, it was 8 to 8.5. So it is keep reducing it. When the economy grows, annuity rates will come down. Okay, now to give you the basics about what is the financial plan. One is you create a wealth through your salaried income, or it could be your professional income, right? So could be you'll be working in multiple hospitals as a consultant, and you may receive various fees. First and foremost is the building blocks could be a protection. What will happen if there is a sudden stoppage of my income? Could be any reason, could be job loss, or it could be disability due to accident, or it could be death. Any of them can stop the revenue flow. So how do you protect your family, your loved ones, if there is a stoppage of your income? That's why you buy through an insurance product, risk management, right? So you buy your risk cover for equivalent amount of either for your expenses, future expenses, or it will be a percentage of number of years of your income. Typically, it's a thumb rule is 10 years of your annual income. You should have minimum term insurance. The second could be a risk-free growth. You want to have some return on your income, but it can be you want to protect your capital. You don't want to take a risk on your capital. Suppose if I'm investing 1 lakh or 5 lakh per year, I want to ensure that the 5 lakh is capital is returned to me without any damage. And it can give me another 5% over and above. I'm happy with it. But people don't want to take a risk on their capital. So we call them as a risk-free growth. This you can buy it through like a PPF, or it could be insurance products. The third one is the growth with risk. Typically, growth with risk comes as your properties, right? You buy a property, maybe 10 years down the line, the property grows multifold. But there could be a risk if there is market is downward, like the COVID situation. Last 2 years, the real estate market was down. The property growth was not there. So that is the risk you take. Or it could be equity investment, stock market investment, where you enjoy on average, if you look at it, a 10 to 15-year period, you'll have a double-digit returns. We call it as a 10 to 15%, you'll have an average return. But at a given time, there could be a possibility you'll have a negative return. Typically, in the year of, say, 2021, when the COVID hit, all the investments came down, but it bounced back after 1 year. So that left volatility on your investment, on your returns, that we call them as growth with risk. The high growth is, I call them as your entrepreneurial journey, right? If you have your own hospital and or your own business investments, or could be, jointly you can hold some labs and other things, you can invest on your own. Or it could be investing on somebody's on behalf of your family companies or family establishments, which may give you a higher return, which have higher growth. The last one is the speculative, predominantly like your cryptocurrencies, right? You don't know what is that, but everybody is making money on it. Every internet buzzword is about crypto. So you also want to enjoy this. You want to get the 100% quick return, or it could be options and futures trading in stock market, or it could be visiting a casino. All of them will come under speculation. See, this is the building block one an individual should have. You start with the foundation, which is your protection. You want to ensure that your wealth is protected. Then you build building block on top of it. But unfortunately, people want to start from the top. They want to make a quick money. They want to have 100% return. So this is where they start to build it, and probably at the end of the journey, they will lose their wealth itself. So this also happens. So what are the 3 dimensions you should look for any of your investment? Okay, it can be as simple as purchasing a land next to your door. Look at it. One is the safety of that instrument, right? Somebody will hijack my property tomorrow if I am not there, if I am not around, if I go abroad, what will happen to my property? Or could be liquidity. When there is a need for me, if I want to sell it, should I sell it at underpricing it, or the market will give me a reasonable profit? Third is the yield, nothing but a return. What will I get it? So these 3 parameters, if you look for any of your investment, even as small as buying, you can look at it your own mobile phone also, you can look at this 3. What am I going to get if I upgrade my mobile phone? Do I get any value out of it? So these 3 parameters will help you to determine, choose the investment vehicle based on your requirement. I just want to give you the 8th wonder, I call it, compounding, basically. The money grows if you leave it over a period of time, and if you keep on adding it up.
Sir, a little volume, please, sir. Volume.
Okay.
Loudly. Yes, sir.
Okay. Probably I will remove my speaker. That will be better. I think. 1 second. Okay now.
Okay, okay.
Is it better now?
Now,
Yes, sir. Yes,
very
yes,
much fine,
please.
sir.
Hello. Am I audible now, madam?
Yes, sir.
Yes,
Very
sir.
much.
Yes,
Very
now
audible,
very
sir.
clear.
Hello.
Yeah, please proceed, sir.
Is it audible now?
Yes, sir.
Hello. Okay. No, or hello.
Yes, sir. Little more louder, sir.
Hello. Hello. Hello.
Sir, it is very clear, sir.
Now it is okay
Please
now.
proceed, sir. Please.
Yeah. Okay. Thank you.
Very clear.
Thank you.
Yeah.
Okay.
Please proceed, please.
Thank you. Basically, if you look at it, you are investing in a simple interest. You keep adding every year. If you look at the journey, you start with 1,000 rupees in both scenarios. One is you are putting in a compounding product, where the interest is getting reinvested. The other one is you are taking the interest out from your investment. The simple interest after 10 years, if you look at it, this grows around 20,000 rupees, whereas this is grown 26,000. But come back and look at the age of 20 years, substantially you'll find the difference. And if you come to 30 years, this will become just to 40, this will be exponential growth. This is the effect of compound interest. So there's a real long-term investment. If you make, you will see the wealth is outgrown. So this is the eighth wonder. And unfortunately, not majority of them are interested for the long term. They want always a quick money, whereas long term, really you can able to build your wealth substantially. So let's probably start with what the lessons we learned from the pandemic, right? Even people who earn reasonable money, or we call them as HNI, do not have a risk cover. When something happened, loved ones lost their life, suddenly we look at the families are no on the road. The risk cover, people think that now there is no death for them, but all of us are, one day we have to call it a day. The risk is inevitable. So you should have an adequate risk cover. How do you buy that? Basically, if you have any liability for your any loan, for your, it could be your property loan, or it could be your hospital loan, or it could be your vehicle loan, or your children's education loan. So you should have, first you should protect your liability. You don't want to leave any debt to your loved ones. You don't create a wealth, at least don't leave a debt. That's the first step one. The second step could be, you should have, at least your expenses should be protected. See, I may earn today 5 lakh per month, but my family needs only 2.5 lakhs. Remaining 2.5 lakhs we invest. So minimum, they should have minimum of 2.5 lakhs income to manage their life in future. Right? The third could be your income protection. How much you will earn next 20 years or 30 years. Protect that, buy a term product. That is the cheapest way of getting your cover, insurance cover. Of course, if you live, you don't get any return on that money. Okay, don't look at the return on these products. The home products are as insurance cover where you buy in case if happens, death happens, or risk happens. Otherwise, there won't be any return on these products. But they are the best investment vehicle to take care of your liability and your income protection. Of course, each one of you talked about early retirement or no retirement for doctors. I think the previous speakers have talked about that. This is to cover there are concepts called the whole life plan. As long as I live, I would like to have income protection. So you should also consider as a doctor, as few of you taking it no retirement as a goal, right? You want to work till the last day. So probably you should have income also protected throughout your lifetime. So you can explore this. The second area where we found important for everybody, every individual or every professional is the emergency fund. What happens if there is my income stops and the pandemic situation where you couldn't earn your regular income? I know some of the doctors took a pay cut for the initial few months. Some specialists have been left the organization also. So minimum is 6 months of your income. You should keep it in an emergency fund. And please don't take your personal loan for everything. I know doctors receive phone calls from every bank or every investment provider, which where they give you personal loan. Saying your professional, they give you a personal loan. They give you 10 lakhs, 20 lakhs. I have seen many doctors leveraging this. Unfortunately, if you buy beyond of the 30% of your income, if you pay as a EMI, you will end up in a debt trap. You will only servicing the debt. You will never able to come out of the debt trap. And kindly avoid leveraging your credit card. I have seen few of the doctors leverage credit card heavily. They have 5 lakh, 10 lakh outstanding on credit cards. Kindly avoid it. That's day one. And build up your cash reserves as much as possible. This is the emergency kitty for everyone. This rule is not applicable for every individual. This is what I gave you about the EMI. If you look at it, there are doctors who earn reasonably good money, say 5 lakh or 6 lakh. But if you go and ask them, they'll have 3 lakh as EMI or 4 lakh as EMI. There are big villas investment or some hospital investment they have made for business investment, right? Then could be a big car. Because as Dr. Kurian said, what you look for? You look for a taste of coffee or a cup of the coffee, right? Sometimes we go for luxury items for a social status. But as a planner, I would like you to have good coffee as well as good cup too. So I don't want to discourage you to not to have good cup, but ensure that you don't get into a debt trap. And understand each of the asset class and their dynamics. That's very, very important. And as much as possible, reduce your liabilities. I just wanted to give, Doctor, do you have time? Because I know we are constrained with the time. So. Doctor?
Hello, yes, sir.
Do you have an extra minute or two, or?
Yeah, 1 or 2 minutes you can take, sir. But the other speaker is waiting,
no,
so don't take long.
Then probably I'll share my this thing. Probably we'll have individually if they have any questions they can send me.
We really had a good talk, sir. It was very, very informative for most of the people who have written here. Thank you very much, sir.
Thank you.
Thank you.
Thank you. Thank you for the opportunity.
And those of you who are here, and this is Mr. Rajaguru. He's a financial consultant. He's a very good friend of my friend's friend. So this is his address, email. Any personal consultations, he is always available. Thank you all very much. And thank you, Mr. Rajaguru, sir. Let's now move on to Patel, sir. Hello, is Dr. Patel there, sir? Am I audible?
Yes. Is my screen seen?
No, sir, not yet. It is coming, I think. I think it will be.
No. Yeah, my desktop is seen?
No, sir, not yet.
Now?
It is coming. It is coming now. Yeah. Now the desktop, now the screen is seen. Your presentation is seen. You have to go to the slideshow. Yeah, full screen is not. No, not full screen. It is the regular slides.
So problem is the same. Full screen is not possible. So will it do this way?
Yeah, it is okay, sir. We'll go this way itself. No problem. Only you have to select every slide and talk. That's all. No problem, sir. We are able to see your slide.
Okay. Okay then.
So only the percentage you increase, sir. 100% you keep.
For that, again, there will be some problem. Because some of
No, so just keep increase. Now 58, 53 it has come. Go to the right side, it will increase the size alone. Otherwise, let us not go to full screen mode. You go ahead with your talk.
But
yes, now 71%.
But in this case, is it sinful?
No, it's not coming full screen. It is okay.
But it is important line may be cut now.
No, it won't get cut, sir. It will not get cut. We are able to see the entire thing. We'll be able to see the working this thing mode it is in. That's all. No problem. We will see like this itself.
I am seeing my slide number 3. Is it necessary to know law?
Yes, sir. We are also seeing that. Is it necessary to know law?
Okay. So warm welcome all the delegates and wishing you a litigation-free practice. At the outset, I would like to thank TNFOG and Dr. Vijayalakshmi in particular for inviting me to share my view about the subject. Usually, I start any of my talk with this question: is it worth discussing? Yes, and if it is yes, then why? So this is statistic from Professional Protection Scheme, which is run by Indian Medical Association Gujarat State Branch, and see the total enrolled members last year 16,485, and out of those 3,113 friends were facing litigation in one way or other, either at district forum, state commission, national commission, Supreme Court, criminal cases, civil cases. So that way they were facing litigation in one way or other. So it simply means almost it comes to 18 to 20%. So every fifth medical person is facing litigation is the problem. And we gynecologists rank first as far as litigation part is concerned. So many times question comes why it is increasing. So whether it is awareness on part of people or attitude of society like this. I learned law so well. The day I graduated, I sued the college, won the case, and got my tuition fee back. Same way, I got cured, paid fees to hospital, sued, got the fees back with huge compensation. So is this attitude of society nowadays? And as far as Consumer Protection Act is concerned, which was enacted in 1986, and at that time medical services were not included under CPA 1986. But with this case of VP Santa versus Indian Medical Association in 1995, medical services were included in this CPA. So in our day-to-day practice, we are taking utmost care of our patient, but many times accident may happen like this, and we may have to face a problem in many times. So as far as this is concerned, ignorance of law is never an excuse, because as soon as any law, any act, any ordinance passes in government gazette, it is presumed by law that each and every citizen of India knows that law. So ignorance of law can never be an excuse. And previously it was considered doctors are next to God, but now doctors are practicing medicine. They are not God. And now we have started defensive medicine, and almost 83% physicians practice defensive medicine. So should we know law is the question? Yes, because we should be well aware with all the provisions of law which are pertaining to our medical practice. We should have knowledge, and to avoid defensive medicine, and know our rights as far as legal rights are concerned. And when we know law fully, then it becomes a safeguard as far as practice is concerned. And as far as medical practice is concerned, we have to go with so many laws: labor laws, PCPNDT, criminal cases, CPA, MTP Act, Professional Tax Act, Atrocity Act, Income Tax Act, Biomedical Waste Disposal Act, Birth and Registration Act, Hospital Establishment Act, ART and Surrogacy Bill, and Medical Council, and now new version of Medical Council. So it is long list of almost 153 different laws and acts which are pertaining to our medical practice. So our situation is like this: we are studied with so many laws, and we have to practice. Am I audible? Hello.
Sir, yes, sir, you are audible, sir.
Yes. So should I continue? So
Yeah, please continue, sir.
So
Continue, sir.
let's see few of the acts which are pertaining in our day-to-day practice. So this is MTP Act, which is very common practice as far as our MTP part is concerned. So for that, center must be registered, person must be qualified, opinion of one registered medical practitioner up to 20 weeks of the pregnancy when termination is considered, and it should be in Form 1. It is prescribed form. As far as pregnancy from 20 to 24 weeks, 2 registered medical practitioners' opinion in some special category, and there is Form E is to be filled up. Beyond 24 weeks of pregnancy, in fetal anomaly which is incompatible with life of fetus, medical board's opinion is required, and that opinion is to be given by medical board in prescribed Form D. As far as beyond 24 weeks of pregnancy is concerned, say for example, rape victim with normal pregnancy with petition in High Court seeking permission for termination of pregnancy. Consent is very much mandatory in Form C, and all the necessary record to be sent in prescribed form, that is Form 2, to the appropriate authority in stipulated time. So as far as MTP Act is concerned, these are some carry homes as far as this Act is concerned. As far as PCPNDT Act is concerned, it is cognizable, non-bailable, and non-compoundable. Cognizable means any investigating officer may take cognizance and initiate investigation. Non-bailable means bail cannot be granted at police station level and can only be granted in court only. And non-compoundable means once complaint is lodged, result has to come either in favor or against. Case cannot be withdrawn in between. So these are the provisions of PCPNDT Act. And as far as this Act is concerned, the serious provision is name of registered medical practitioner shall be reported by appropriate authority to State Medical Council for necessary action, including suspension of registration if charges are framed. So merely on framing of the charge, Medical Council may take action to go for suspension of registration. And so many of our friends are facing this problem, and their registrations are suspended as far as Medical Council and now newer version NMC is concerned. So it is little serious one as far as PNDT Act is concerned. So how this can be prevented? No obstetric practice, but it is not possible. No sonography practice, but it is only 50% solution. No preconceptional sex selection, no prenatal sex determination. But even then, comply with the provisions of Act is very much important. So registration of center is very much important, because one can practice only if center is registered in any of this category, either genetic counseling center, genetic laboratory, genetic clinic, or ultrasound clinic and imaging science. So as per practice, center should be registered is very much required thing as far as this registration part is concerned. Once your center is registered, then certificate of registration should be displaced at conspicuous place is one more requirement as far as PCPNDT Act's provisions are concerned. So as far as registration is concerned, it is valid for 5 years. As far as renewal is concerned, it should be applied 30 days prior of expiry of certificate of PCPNDT Act. There is also provision of dim renewal also. Once you have applied for renewal and there is no communication on part of appropriate authority within 90 days, then your registration is automatically renewed. It is dim renewed. And this type of board is to be displayed at conspicuous place, but it differs from state to state and district to district. Many a times this is to be displayed name of hospital, address of hospital, and this type of writing. Antenatal sex determination is punishable offense and sex determination is not done here. So this type of board is to be displayed at conspicuous place. But maintenance and preservation of record is very much important, because as far as this section 4 subsection 3 is concerned, any deficiency or inaccuracy found in record shall amount contravention of provision of section 5 and 6 of Act unless contrary is proved by the person conducting antenatal ultrasonography. So even if there is a deficiency or inaccuracy in record, then also case can be filed. So we should be very particular as far as maintenance of and preservation of record is concerned. So this is prescribed register under Rule 9 Sub Rule 1. We have to maintain this register with 4 columns: serial number, name and address of patient, name of husband or father, and date on which they first reported for such counseling procedure or test. So this is a prescribed register we have to maintain. We have to preserve all this: form of consent, laboratory results, microscopic pictures, sonography plates, like recommendation sheets. When patient is referred by somebody with reference sheet, then we have to preserve that recommendation sheet also. There are some prescribed form. As far as genetic counseling center is concerned, Form D, laboratory, Form E, genetic clinic or ultrasonography center, Form F, and if you are dealing with invasive procedure, then Form G. But very important part is this declaration on part of pregnant woman who is undergoing sonography. So signature of a patient is very much important. If patient is giving thumb impression, then thumb impression should be attested by some known person. Same way, declaration on part of person doing sonography is also very much important. It should be in Form F as well as at the end of report also. When you are giving separate report to the patient, as far as ultrasound examination of antenatal patient is concerned, at the end of report, this type of declaration is very much required as per Rule 10 Sub Rule 1A is required. I, Dr. So-and-so, declare that while conducting ultrasonography and imaging science on so-and-so patient, I have neither detected nor disclosed the sex of her fetus to anybody or in any manner. So it is very much important. Written consent of pregnant woman is mandatory, and irrespective of gestational age, you have to do it. And one copy is to be given to the patient. So as far as all these prescribed forms are concerned, it should be in duplicate. One is to be kept for office record, and one is to be sent to appropriate authority at the end of month within 5 days of next month. You can have a record on computer or any other electronic equipment, but printed copy of record shall be taken and preserved after authentication by a person responsible for the all this record. So you are under obligation to preserve records for 2 years, and in event of any legal proceeding till final disposal of legal proceeding, or 2 years, whichever is later. As far as change of employee, change of place, change of address, and change of equipment is concerned, we have to intimate appropriate authority under Rule 13. Previously, it was done to be done within 30 days, but with amendment, before 30 days, we have to inform about the same. and details of newly installed machine should be incorporated in Form B. If you have installed new machine, then before 30 days, you have to intimate authority that you are going to buy new machine with this detail, make, model, and number of the machine. And when you install, then all the details and Form B is to be surrendered to the appropriate authority for necessary change. It is very obvious that one cannot buy, install, or use sonography machine for antenatal sonography unless center and machines are registered. In case of repair of machine, many times we have to go for repair of machine also. So in this type of situation, intimate appropriate authority. If it is permanent non-use or buyback to the company, then surrender certificate of registration to appropriate authority if you have only one machine. If you have more than one machine and one machine is out of order and permanent non-use or buyback to company, then you have not to surrender registration. As far as PNDT parts are concerned, there are so many problems, and you have remedy also. When notice is issued, machine is seized, registration is suspended, registration is cancelled. So in this type of condition, you have option of appeal under section 21 and rule 19 within 30 days. So you can go for appeal to higher authority. Say for example, if it is result of sub-district appropriate authority, then you can go to appropriate authority. If it is result of state appropriate authority, then to state government. Then in chronology, you can go to central appropriate authority, central government, etc. You have also remedy as far as judicial remedies are concerned. In judicial magistrate first class, metropolitan magistrate, sessions court, high court, and Supreme Court in succession. One more law we have to know, that is Registration of Birth and Death Act 1969. In event of birth, death, or stillbirth in our hospital, we are under obligation to register to appropriate authority. There are 3 prescribed forms. Form 1 is for live birth, Form 2 is for death, and Form 3 is for stillbirth. So we have to intimate authority within 20 days of incidents happen. So it is very much important to register birth, death, or stillbirth. As far as Biomedical Waste Disposal Act is concerned, this is one more act we have to be very careful. So we have to register with a pollution control board of respective state, and we can hire one company for proper disposal. But as far as our part is concerned, we have to maintain and train our staff for segregation of all this biomedical waste, how it should be keep in certain bags. So there are different colors of bags. As far as yellow part is concerned, human anatomical waste like human tissue, organ, body parts also. As far as red color bag is concerned, disinfected container or plastic bag. In this, waste from laboratory, specimen, culture are to be preserved. So as far as blue or white transparent bag, so this bag should be puncture proof, because in this bag we have to preserve needles or any sharp waste. So syringes, scalpel, blades, etc. So we have to preserve that. In black bag, discarded drugs, say for example expiry drugs or incineration as also. So in all this, you have to segregate in different bags, and person who is giving you service for final disposal will collect in that respective bag for proper disposal of this biomedical waste. One more act we have to go for, that is Income Tax Act, and under this act we have to preserve all this book, cash book, journal, ledger, and carbon copy of numbered bills, daily cash register, that is OPD register in Form 3C. It is a prescribed form from Income Tax Act, to be preserved for 6 years from the end of relevant assessment year, and failure to maintain register may cause penalty of 25,000 as far as income tax part is concerned. So application for allotment of permanent account number when you are starting your practice in private, it is very much important. An income tax return is to be filed in prescribed form in stipulated time is very much needed. One more act, Bombay Nursing Home Registration Act, but it may differ from state to state. So if it is applicable in your state, then you have to observe that also. So it is required for registered hospital as far as Form C is concerned, and Form C is needed as far as mediclaim patients are concerned. When they are claiming, we have to give Form C. This is a form of registration of our hospital under Bombay Nursing Home Act. But just I mentioned, it differs from state to state. One more act is Bombay Shop and Establishment Act. It is again from state to state. So if it is applicable, then also only we have to go for. As far as professional tax is concerned, so tax for profession and applicable to doctor in service also should obtain registration number, and first 5 years of business it is exempted. If income tax number is obtained by doctor, then this exemption is not available. So as far as this professional tax is concerned, hospital will have also to go for professional tax, and from your staff whom you pay, you will have to deduct professional tax, and within quarter you will have to submit all those deducted tax to respective authority. And there is a table how much tax is to be deducted from the salary of your staff. As far as minimum wage act is concerned, you are under obligation to pay your all the staff as far as minimum wage act is concerned. Again, it is state act, so it differs from state to state. So you should know provisions of this act according to your state. One more act, ART and Surrogacy Act, but it needs a separate lecture for the same. So due to paucity of time, I do not go into the detail. One more, that is NMC bill. Recently, there were amendments as far as NMC bill is concerned, and it is going to be published in government gazette very soon, and then it will be applicable. So as far as our practice is concerned, many times we are happily enjoying this type of parachute sailing in our practice, but we never know this much crocodiles are ready to receive us at the bank. So to conclude my talk, comply with the law of land and remain alert every time. Otherwise, be ready to face problems as far as laws are concerned. So in spite of all this professional and occupational hazard, our journey to serve human and mankind is always on and on. A small slip can make a big trouble. So an ounce of prevention is worth more than a ton of cure, which is rightly said in Panchtantra. So if at all, if you want to sleep like this, take tender care of your patient. Comply with the provisions of law of your land. Pray your Almighty God before going to sleep, and keep my visiting card below your pillow. I am always to help you in any given situation. If ever you need me, I will be just round the corner. With regard, salute to the organizers. Thank you very much. Please do not assume. Please ask if any query. If time and chairperson permit. Thank you very much.
Sir, that was really a very, an exhaustive, but very, very informative and practical lecture, sir. Yeah, I mean, we could get all the points for
Hello.
Hello.
Hello. Sir, that was an excellent talk. I now
Thank you.
like to invite Vijay Gnanashekaran madam to give
very sorry, there's some kind of wait a minute, I'll go ahead, please wait. Dr. Mary Ann is not there, so I'm just concluding it. So thank you very much, Patel sir, for this excellent lecture. On behalf of Mary Ann madam, who was supposed to be the chairperson, she had to leave in an urgent situation. So thank you very much, sir. With this, we wind up the second session.
So,
and
due to this network issue, I couldn't show this slide in full screen. Otherwise, some videos were there, and it would have
yes, sir.
Better. No problem. Any other time.
Definitely, sir. Definitely. I think this was really very good.
And we are very happy that you are always there to rescue us, and your visiting card would be there. I mean, hope we don't have to use it. We will sleep peacefully with your advice. Thank you very much, sir.
Thank you.
With this, we come to the end of today's CMA program. And Meena,
now I would like to welcome
I need
ma'am.
Meena, I need no introduction. Meena,
Over to you, ma'am.
yeah, thank you, Meena. Paucity of time, so no need to introduce me. Thank you all very much. I first of all would like to thank our dear God for giving this opportunity. It was really a wonderful thing to hold this or organize this CME program for the well-being of doctors. I thank my dear President, Dr. Anjalakshi Chandrasekhar, and Secretary, Dr. Sampath Kumari, for bestowing this opportunity on me, and all the TNFOG EC members for having accepted and contributed in their different ways for the success of this program. I would like to thank Dr. Kurian Joseph for having been the chief guest for the function, for being with us, for inaugurating the function, and for releasing the e-newsletter, and for sharing your words of wisdom, and for encouraging us on this CME program. My dear thanks to all the chairpersons, Dr. Vasantamani Madam, Dr. Malati Prasad, Dr. Preeti, and Dr. Mary Ann Raja. All four of you were excellent, though due to some personal difficulties and last-minute emergencies, one or two people could not join, but still thank you all so much for the cooperation that you have extended and for chairing the sessions. Dear thanks, thanks from the bottom of my heart to all the speakers who have done excellently well today. Dr. Radha Madhavi Madam, Dr. Selva Kumar, for their talk on the health aspects, to Dr. Nancy Tanu Madam, who's supposed to, she spoke on the post-retirement and she said, please don't retire. Thank you very much. And thanks to Mr. Rajaguru, the financial consultant, and Dr. MC Patel sir on this excellent talk on the legal aspects, what we need to know for a safe practice. Thank you, dear Meena, for coordinating the entire evening's program. Thanks to Shield Pharmaceutical for your support. Special thanks to Chitrakala and her team for designing the invites, for being with us throughout in this program. And very many thanks to Priya, our secretary, for always being there with us, for conducting the program and all kind of cooperation that you extend, and for the platform that you arrange for sharing the webinar. I think I could see only Rajaguru sir on screen. I'm unable to see others. So if anybody is there, please log in with your video on so that we can just have a last minute picture and we can wind up. Thank you, dear God, for this one more day of opportunity. Thanks to everybody. If I have left anyone, it's only by mistake. Kindly forgive me. Thank you. Yes. Chandra ma'am, thank you. Whoever is there, Preeti madam, thank you. Anybody else? Meena, hi. Rajguru sir, thank you. Patel sir couldn't join with video previously itself. Okay. Chandra ma'am. Chandra ma'am. Okay. I think we'll call it a day. Thanks to everybody. Bye-bye. Hello? Yeah.
Ma'am?
Hello, Priya.
இல்ல மேம் அத எல்லாரும் வைண்ட் அப் ஆகட்டும் then close it.
Okay. Thank you very much.
Thanks, ma'am.
One person whom I didn't thank are my dear delegates. Thank you all so much. So many people till the last minute. Thank you very much. Bye. I will leave, Priya.
Okay, ma'am.